دكتورة ماري حبيب، ماجستير إدارة جودة الرعاية الصحية من المعهد العالي للصحة العامة جامعة اسكندرية. هنتكلم النهاردة عن ال AI Powered Population Health. مع بعض من خلال إن شاء الله 6 سيشنز. النهاردة هنتكلم عن الرول of artificial intelligence in population health. يعني إيه population health؟ ونفهم الدور بتاع البيج داتا في البوبوليشن هيلث، واستخدامات الماشين ليرنينج فاندامنتالز فور population health professionals. وهندسكاس يعني ايه ال artificial intelligence powered risk stratification and intervention design. كمان هنتكلم عن ال AI for health emergency preparedness and response. وفي الآخر هنتكلم يعني إيه إزاي نعمل action planning وال next steps for collaboration في ال population health. قبل ما نبدأ أستأذن حضراتكم لو تكتبوا لي تخصصاتكم في الشات علشان نعرف نتكلم مع بعض. تمام. dentist و clinical nutrition، radiology. تمام، احنا هنتكلم في اول سيشن عن introduction عن ال artificial intelligence في ال population health. علشان نعرف نتكلم مع بعض، اول حاجة لازم نفهم يعني ايه ونتكلم عن ال definition بتاعة ال population health. Population health refers to the health outcomes of a group of individuals, including the distribution of such outcomes within the group. It encompasses a wide range of factors that contribute to the overall health of a population, including social, economic, environmental determinants, healthcare delivery, and individual behaviors. في عندنا key concept في ال population health. أول حاجة ال health determinants زي إيه؟ زي social determinants, conditions in which people are born, grow, live, work, and age, such as socioeconomic status, education, physical environment. في كمان behavioral determinants زي ال lifestyle choices، زي ال behaviors such as diet, physical activity, smoking, alcohol use. في كمان genetic determinant, genetic makeup that influence individual health outcomes. و healthcare access and quality زي ال availability and quality of healthcare services and how they are accessed by different population. كمان هنتكلم عن ال health outcomes زي ايه؟ زي ال mortality rates، زي ال morbidity rates. morbidity سواء incidence, prevalence of diseases، زي ال life expectancy، زي ال quality of life. كمان هنتكلم عن ال health disparities، differences in health outcomes between different population groups that influenced by social, economic, environmental disadvantage. كمان هنتكلم عن ال interventions and policies, strategies and policies aimed at improving health outcomes and reducing health disparities. This can include public health initiatives, healthcare reforms, and community-based programs. We data and measurement اللي هي collection and analysis of health data to monitor and evaluate health outcomes, وإن identify trends, inform policy decisions. يبقى هنتكلم أول حاجة عن ال health determinant in population health. Health determinant in population health are factors that influence the health outcomes of individuals and communities. These determinants can be broadly categorized into social determinants, behavioral determinants, genetic determinants, environmental determinants, health care access and quality. Understanding these determinants is very important for designing effective public health interventions and policies. Social determinants. These are the conditions in which people are born, grow, live, work, and age. They have a significant impact on health outcomes and contribute to health disparities. زي socio-economic status includes income, education, occupation. Education, higher levels of education are linked to better health, knowledge, healthier behavior, improved health outcomes. Employment status and job conditions affect health, with unemployment and job insecurity being linked to poorer health outcomes. Social support networks. Strong social ties and support systems can improve mental and physical health. Neighborhood and built environment includes housing, quality, availability of healthy foods, access to recreational spaces, and safety. Poor living conditions can negatively impact health. تاني حاجة behavioral determinants. These are the action individuals take that affect their health, زي diet and nutrition. Healthy eating is very important for preventing chronic diseases such as obesity, diabetes, cardiovascular diseases. Physical activity. Regular physical activity reduces the risk of many health problems, including heart disease, stroke, some cancers. Substance use, such as tobacco, alcohol, and drug use can lead to numerous health issues, including addiction, liver disease, lung cancer. And health-related behaviors includes practices like hand washing, vaccination, and adherence to medical advice. Number 3, genetic determinants. Genetic makeup plays a role in determining an individual's susceptibility to certain diseases and health conditions. Inherited traits. Some genetic conditions and predispositions can be inherited from parents, influencing health outcomes. Gene-environment interactions. How genes interact with environmental factors can also affect health. Environmental determinants. These include all external factors affecting health, both natural and man-made. Physical environment includes air, water quality, exposure to toxins, and climate conditions. Poor environmental conditions can lead to respiratory diseases, cardiovascular conditions, and other health issues. Workplace conditions. exposure to hazardous materials, physical demands, and workplace safety can impact health. Healthcare access and quality. Access to and the quality of healthcare services significantly influence health outcomes. Healthcare services, availability of primary care, specialty care, emergency services, and preventive services. Health insurance coverage affect access to healthcare services and financial protection. Healthcare quality, the effectiveness, safety, patient-centeredness of healthcare services. Addressing health determinants, effective public health strategies to address these determinants include policy interventions, regulation to improve socio-economic conditions, environmental standards, and access to health care. Community programs, initiatives aimed at improving social support, education, health behaviors within communities. Healthcare system reforms, enhancing the accessibility, affordability, and quality of healthcare services. Education and awareness campaigns promoting healthy behaviors and lifestyle through public education. By addressing the wide range of health determinants, population health initiatives can improve overall health outcomes, reduce health disparities, and create healthier communities. Understanding and acting upon these determinants is key to achieving long-term public health goals. يبقى احنا اتكلمنا عن الكي كونسبت في البوبوليشن هيلث، اتكلمنا عن الهيلث determinants، هنتكلم عن الهيلث outcomes. زي ما قلنا الهيلث outcome في البوبوليشن هيلث زي المورتاليتي، morbidity، life expectancy والquality of life. ايه المورتاليتي؟ سواء الاوفرول mortality rate، the total number of deaths in a population within a specified period، أو co-specific mortality rate اللي هو number of deaths attributed to specific causes زي heart diseases، cancers، diarrhea diseases، HIV. الموربيديتي في الانسيدنس، يعني النمبر of new cases of a disease or condition in a population during a specific time period. والprevalence total number of existing cases of a disease or condition in a population at a given time. وفي disease specific morbidities زي يعني اللي هي frequency of specific diseases or condition within a population زي الديابيتس، الأزمة. life expectancy. Life expectancy at birth. The average number of years a newborn is expected to live under current mortality conditions. life expectancy at a given age, the average number of additional years a person of a specific age can expect to live. quality of life زي physical health، general physical well-being including the absence of disease and the ability to perform daily activity. mental health اللي هي psychological well-being and the absence of mental disorders. social health the ability to form satisfying interpersonal relationship and interact socially. والfunctional status, the ability to perform activities of daily living and maintain independence. في ايه هي strategies to improve health outcomes؟ عن طريق preventive care، promoting vaccination، نعمل screening، lifestyle modifications to prevent disease onsets، chronic disease management، implementing programs to manage and control chronic conditions, reducing complications and improving the quality of life. Health education, providing information and resources to encourage healthy behaviors and informed health decisions. ونعمل policy intervention, enacting policies that address social determinants of health, improve healthcare access, and ensure environmental health. Understanding and measuring health outcomes is fundamental to advancing population health. Effective strategies to improve these outcomes involve a combination of healthcare services, public health initiatives, and policy measures, all tailored to address the specific needs and challenges of different populations. اتكلمنا في الكي كونسبت في البوبوليشن هيلث عن الهيلث ديترمينانت، الهيلث اوتكمز. هنتكلم عن الهيلث ديسباريتيز. الهيلث disparities في البوبوليشن هيلث. There are various aspects of health disparities within population health. هنتكلم عن السوشيو economic disparities، الريشيال and ethnic disparities، الجيوغرافيك disparities، والجندر disparities، والage disparities. السوشيو economic disparities زي مثلا income inequality، differences in health outcomes related to income level, where lower income groups often experience poorer health outcomes. Education disparities in health based on educational attainment, with lower educational levels often associated with worse health outcomes. Occupation health disparities linked to job types, job security, and working conditions. Racial and ethnic disparities. Access to healthcare. Variation in access to healthcare services among different racial and ethnic groups. Quality of care. Differences in the quality of healthcare received by different racial and ethnic population. With disease prevalence, higher prevalence of certain diseases in specific racial and ethnic groups. كمان geographic disparities زي urban versus rural. Health differences between urban and rural populations, often due to availability of healthcare services and infrastructure. Regional differences. Variation in health outcomes based on geographic regions, influenced by factors such as environmental conditions and local healthcare systems. Gender disparities. Life expectancy. Differences in life expectancy between males and females. Disease prevalence. Gender-based differences in the prevalence of certain diseases and health conditions. Access to care. variations in access to and utilization of healthcare services between genders. Age disparities, childhood health, health disparities affecting children influenced by factors such as nutrition, immunization, and socioeconomic conditions. والelderly health challenges and disparities faced by the elderly population, including access to geriatric care and management of chronic diseases. ايه هي الستراتيجيز to reduce health disparities؟ إن نعمل policy interventions, implementing policies that aim to reduce socioeconomic inequalities, improve access to education, and ensure equitable healthcare access. Community programs, developing community-based programs that target vulnerable populations and address specific health needs. Cultural competence in healthcare, training healthcare providers to understand and respect cultural differences to improve care for diverse population. Targeted health intervention, designing health interventions that specifically address the needs of disadvantaged groups. Research and data collection, conducting research to better understand the health disparities and monitor progress in addressing these disparities. Health disparities represent significant inequalities in health outcomes among different population groups. Addressing these disparities requires a multifaceted approach, including policy change, community engagement, culturally competent healthcare practices. By focusing on this area, public health initiatives can work toward achieving health equity and improving the overall health of population. في الكي كونسبت في البوبوليشن هيلث اتكلمنا عن الهيلث ديترمينانت، الهيلث اوتكمز، الهيلث ديسباريتيز. هنتكلم عن الانترفنشنز اند بوليسيز في البوبوليشن هيلث. There are various interventions and policies in population health. زي ايه المين كاتيجوريز؟ البابليك هيلث انترفنشنز، health care policies، social policies، environmental policies و behavioral interventions. البابليك هيلث انترفنشنز زي ايه؟ زي الفاكسينيشن programs، initiatives to immunize population against infectious diseases, preventing outbreaks, and reducing morbidity and mortality. Health education campaigns, programs aimed at informing and educating the public about health behaviors and preventive measures. Screening and early detection, efforts to identify diseases early through screening such as mammograms, blood pressure checks, diabetes tests. Healthcare policies زي universal healthcare coverage, policies aimed at providing healthcare access to all individuals regardless of income or social status. Healthcare quality improvement, initiatives to enhance the quality of care provided, ensuring patient safety and effective treatments. Cost control measures, strategies to manage and reduce healthcare costs making healthcare more affordable and sustainable. with social policies زي income support programs, policies that provide financial assistance to low-income individuals and families, reducing poverty and its associated health risk. Housing policies, initiatives to ensure safe, affordable, stable housing, which can improve the overall health and well-being. Education policies زي programs aimed at improving access to quality education, which can lead to better health outcomes through increased health literacy and socioeconomic opportunities. environmental policies زي pollution control، يبقى في regulations and initiatives to reduce air, water, soil pollution, protecting public health from environmental hazards. Climate change mitigation, efforts to address climate change, which can have widespread health impacts, including extreme weather events, vector-borne diseases, and food insecurity. urban planning, designing cities and communities to promote healthy living, including access to green spaces, safe transportation, and healthy food options. behavioral interventions زي smoking cessation programs, initiatives to help individuals quit smoking, reducing the risk of smoking-related diseases. nutrition and physical activity programs, efforts to promote healthy eating and regular physical activity, addressing obesity and related health conditions. substance abuse prevention and treatment, programs aimed at preventing and treating substance abuse, improving mental and physical health outcomes. implementation strategies زي مثلا policy advocacy, efforts to influence public policy and decision making to prioritize health and well-being. community engagement, involving community members in the planning and implementation of health initiatives, ensuring they are culturally relevant and effective. intersectoral collaboration, working across different sectors زي health, education, housing to address the broad determinants of health. monitoring evaluation، ازاي بنعمل لها monitoring evaluation عن طريق health data collection، gathering data to monitor health outcomes, identifying trends and evaluate the effectiveness of interventions عن طريق ان احنا بنعمل research and innovation، conducting research to develop new interventions and improve existing ones. ويبقى عندي feedback mechanism to create channels for feedback from communities and stakeholders to refine and improve health policies and programs. Effective interventions and policies are essential for improving population health by addressing the various determinants of health through public health interventions, healthcare policies, social policies, environmental policies, and behavioral interventions. It's possible to create healthier communities and reduce health disparities. Successful implementation requires coordination efforts, ongoing monitoring, and a commitment to equity and inclusion. اتكلمنا في الكونسبت بتاع population health عن health determinant, health outcomes, health disparities, interventions and policies. هنتكلم عن data and measurements. Data and measurement في population health. There are various aspects of data and measurement in population health. Categorized في data source, health indicators, analytical methods, data collection and management, performance measurement, reporting and dissemination. data sources زي السيرفيز والكويشنيرز، دول عبارة عن tools used to gather self-reported data from individuals about their health behaviors, conditions, and experiences. في عندي برضو من مصادر الداتا المهمة قوي الالكترونيك هيلث ريكوردز، دي عبارة عن الديجيتال ريكوردز maintained by healthcare providers that contain comprehensive patient health information. كمان الادمنستراتيف data collected through the administration of healthcare services, including insurance claims and hospital discharge records. vital statistics, official records of life events such as birth, death, marriage, divorce, often used to monitor population health trends. health indicators زي mortality rates اللي هي زي ما قلنا measures of the number of deaths in a population categorized by cause, age, any other demographics. morbidity rates, measures of the prevalence and incidence of diseases and health condition within a population. Life expectancy, the average number of years and individuals is expected to live based on current mortality rates. quality of life زي ما قلنا indicators that measure physical mental social well-being including functional status and health-related quality of life. analytical methods عندنا descriptive statistics، دي عبارة عن techniques used to summarize and describe the main features of a data set such as mean, median, mood. inferential statistics دي عبارة عن methods used to make inferences or predictions about a population based on a sample of data, including hypothesis testing and regression analysis. geospatial analysis, the use of geographic information system to analyze health data in relation to location and spatial patterns. trend analysis اللي هي technique used to analyze changes in health indicator over time, identifying patterns and predicting future trends. في data collection and management, data standardizations, ensuring consistency in data collection methods and formats to facilitate accurate comparisons and analysis. Data integration, combining data from multiple sources to create a comprehensive data set for analysis. data quality assurance اللي هي processes to ensure the accuracy, the completeness, and reliability of data collected and used in health analysis. Performance measurements, healthcare quality metrics دي عبارة عن indicator used to assess the quality of healthcare services, including patient outcomes, safety, satisfaction. في population health metrics, measures that evaluate the overall health of a population, such as the prevalence of chronic diseases, health behaviors, and access to care. وفي equity indicators, metrics that assess disparities in health outcomes and access to healthcare services among different population groups. والreporting and dissemination زي health reports, publications that present data on health indicators, trends, and disparities to inform public health policies and programs. Dashboard and visualization, tools that display health data in an interactive and easily interpretable format for stakeholders and the public. والresearch publications دي عبارة عن academic papers and articles that disseminate findings from population health research and analysis. Data and measurement are very important and critical components of population health. They provide the necessary information to monitor health outcomes, identify trends, assess the impact of interventions, and guide policy decisions. Effective data collection, management, and analysis are very essential for understanding the health of population and working toward improved health outcomes and reduced disparities. By utilizing diverse data sources, employing robust analytical methods, and ensuring the quality and accessibility of health information, public health professionals can make informed decisions that promote the well-being of communities. يبقى احنا كده اتكلمنا عن الاسبكتس بتاعة الهيلث populations. هنتكلم بسرعة جدا عن approach to population health. في عندنا 3 approach. الapproach للpopulation health involve comprehensive strategies aimed at improving health outcomes across entire population by addressing a wide range of factors that influence health. This approach often integrates public health, healthcare, and community-based efforts to create a holistic framework for enhancing population health. The key approach للpopulation health عندنا public health approach, healthcare system approach, community-based approach. public health approach بنتكلم فيها عن preventive care, focuses on preventing diseases before they occur through vaccination programs, health education, screening. بيبقى فيها كمان health promotion, encourage healthy behaviors and lifestyle through campaigns and community programs. وبيتعمل surveillance and monitoring, tracks health trends and outbreaks to inform public health interventions. والhealthcare system approach integrated care بيتكلم عن integrated care اللي هي coordination and coordinates care across different providers and services to ensure comprehensive and continuous care for patients. Patient-centered care emphasizes personalized care that respect and respond to individual patient preferences, needs, and values. Value-based care that prioritize quality and outcomes over the volume of services provided. aiming to improve health outcomes while controlling costs. والابروتش الثالث اللي هو community based approach اللي بيتكلم عن ال community engagement involves community members in identifying health needs and developing solutions that are culturally relevant and effective. In local partnership, collaborate with local organizations, schools, businesses to create supportive environment for health. Grassroots initiatives empowers community members to take active roles in promoting health within their own communities. Effective approach to population health require a multi-phased strategies that incorporate preventive care, healthcare delivery, and community engagement. By integrating these elements, population health initiatives can achieve better health outcomes, reduce health disparities, and create healthier communities. The success of this approach depends on collaboration across sectors, continuous evaluation, and a commitment to addressing the diverse needs of different populations. طيب ايه هي الجولز of public health؟ الجولز بتاعتنا واضحة جدا، واضحة وسهلة. improve the health and well-being of population عن طريق نقلل الموربيديتي والمورتاليتي، enhance the quality of life, increase the life expectancy, reduce health disparities and inequities. يبقى عندي equitable access to care, addressing social determinant of health اللي هي underlying social والeconomic والenvironmental factors that contribute to health inequities, enhance the quality and effectiveness of healthcare services عن طريق إن يبقى عندي value-based care، يبقى عندي integrated care. Promote healthy behavior and environments. Healthy behaviors إن أنا يبقى عندي promote preventive care, disease prevention, health promotions, effective public health policies. لازم أعمل community involvement, empowerment للinitiatives. إيه هي الإكزامبلز للpopulation health initiatives؟ عندنا vaccination programs to prevent infectious diseases, community health education campaigns to promote healthy lifestyles, policies to reduce pollution and improve environmental health, initiatives to address food insecurity and promote nutrition. By taking a holistic approach, population health aims to improve health outcomes across entire communities and populations, ultimately leading to a healthier society. Artificial intelligence is increasingly being recognized as a vital tool in population health for its potential to enhance data analysis, improve healthcare delivery, and support public health initiatives. هنتكلم عن artificial intelligence. يعني إيه كلمة artificial intelligence؟ الديفينيشن بتاع artificial intelligence is the simulation of human intelligence in machines that are programmed to think and act like humans. يعني الماشين هتفكر وتشتغل زي الهيومنز بالظبط. Simulation of human intelligence in machine. ازاي يبقى عندها cognitive abilities زي learning, reasoning, problem solving, perception, language comprehension. كل ديت are all examples of cognitive abilities. It can learn from its experience and adapt to new situations. Artificial intelligence ده عبارة عن methods of making a computer أو a computer controlled robot or a software think intelligently like the human mind. AI is accomplished by studying the patterns of human brain and by analyzing the cognitive process. The outcome of these studies develops intelligent software and systems. يعني ببساطة امتى اقول ان الماشين ديت عندها artificial intelligence when a machine has a general learning، يعني it can learn from experience. يبقى اقول ان الماشين ديت عندها artificial intelligence لما الماشين تقدر تاخد take decision based on information، يبقى الماشين دي عندها reasoning. يبقى اقدر اقول ان الماشين ديت عندها artificial intelligence. لما اقول ان الماشين تقدر create solution to solve a problem، يبقى عندها problem solving. يبقى الماشين ديت it contain artificial intelligence. طيب ايه هما التايبس بتوع الارتفيشال انتليجنس؟ في 3 تايب of artificial intelligence. في artificial narrow intelligence والartificial general intelligence والartificial super intelligence. الartificial narrow intelligence أو بنقول عليه الweak AI. الweak AI refers to AI systems that are designed to perform specific tasks and are limited to those tasks only. These AI systems excel at their designated functions but lack general intelligence. في example of weak AI زي الفويس اسيستنتس سيري. سيري لما في الموبايل اقول لسيري اقول لها كول مام، سيري بتعمل اكسس على الكونتاكتس، بتايدنتيفاي الورد مام and call the number. نفس الوضع مع أليكسا. دول example of weak artificial intelligence. أليكسا تقدر تinteract مع التكنولوجيز that we can use every day. أقول لها تعمل set timers تset التايم، share الcurrent weather تقدر تعمل sharing للcurrent weathers، access الويكيبيديا articles، تقدر تبلاي music من أي applications زي سبوتيفاي account، تعمل لي home automation features. زي ايه كمان الاكزامبل اوف ويك artificial intelligence؟ زي الموبايل فون image recognition system، زي كمان الفينجر برينت to unlock الموبايل فون. كل دول examples ل weak artificial intelligence operate within predefined boundaries and cannot generalize beyond their specified domain. كمان النوع التاني اللي هو artificial general intelligence أو بنقول عليه strong AI. Strong AI, also known as general AI, refer to AI systems that possess human level intelligence or even surpass human intelligence across a wide range of tasks. Strong AI would be capable of understanding, reasoning, learning, and applying knowledge to solve complex problems in a manner similar to human cognition. However, the development of strong AI is still largely theoretical and has not been achieved to date. كمان النوع الثالث Artificial Super Intelligence. Artificial intelligence far surpassing that of the brightest and most gifted human minds في كل المجالات in every field. Due to recursive self-improvement, super intelligence is expected to be a rapid outcome of creating artificial general intelligence. يبقى احنا كده عندنا 3 أنواع للartificial intelligence. الartificial narrow intelligence والartificial general intelligence والartificial super intelligence. Artificial narrow intelligence specializes in one area and solve one problem. Artificial general intelligence refer to a computer that is as smart as a human across the board. Artificial super intelligence an intellect that is much smarter than the best human brains in particularly every field. كمان بنقول على الماشين في artificial narrow intelligence بقول عليه machine learning. الماشين learning ليه؟ لأن بيتم تغذيتها عن طريق الإنسان input data عن specific task. ومعظم الذكاء الاصطناعي artificial intelligence الموجود دلوقتي artificial narrow intelligence في اللي هو الماشين ليرنينج. الإنسان هو اللي بيعلم. الماشين ليرنينج يعني إيه؟ الماشين learning is a type of artificial intelligence that allows a system to learn from data rather than through explicit programming. It involves the use of algorithms that can learn patterns and make predictions based on input data without being explicitly programmed to perform the task. إزاي الماشين learning بيشتغل؟ Machine learning algorithms use statistical models to analyze and draw inference from data. It helps you make predictions that minimize the errors that arise from merely guessing. إيه هي application of machine learning? Machine learning techniques find application across various domains, including image and speech recognition, natural language processing. For example, companies زي Amazon تستخدم use machine learning to recommend product to a specific customer based on what they have looked at and bought before. recommended product اللي بتطلع لنا ديت عبارة عن ايه؟ الماشين ليرنينج بيشوف الكاستمر شاف ايه قبل كده، اشترى ايه قبل كده، وبيديله ريكومنديشن عن طريق الماشين ليرنينج. ده عبارة عن artificial intelligence. طيب في نوع تاني اسمه deep learning. الديب learning دوت subset من الماشين learning that involves artificial neural networks to model and solve complex problems. It's inspired by the structure and function of the human brain زي ما احنا شايفين, specifically the interconnected network of neurons. Deep neural networks عبارة عن deep learning employs neural networks with multiple layers of interconnected nodes أو neurons, enabling the learning of complex hierarchical representation of data. The deep learning algorithm have the ability to automatically extract relevant features from raw data, eliminating the need for explicit feature engineering. The application of deep learning زي computer vision. Deep learning has made a revolution في computer vision tasks such as image recognition, object detection, image segmentation. في natural language processing, deep learning techniques have been successfully applied to natural language processing tasks like sentiment analysis. natural language processing task اللي هي هنتكلم عنها artificial intelligence اللي ليه relation بالlanguage. زي هنا الديب ليرنينج بيستخدم الناتشورال لانجويج بروسيسنج زي في السنتمنت اناليسيس، اللانجويج ترانسليشن، التكست جنريشن، كمان في السبيتش ريكوجنيشن. الديب ليرنينج مودلز power speech recognition systems like virtual assistants and speech to text applications. الماشين ليرنينج، ايه الفرق بين الماشين ليرنينج والديب ليرنينج؟ الديب ليرنينج عندها القدرة انها تعمل اوتوماتيك اكستراكت للريليفنت فيتشر فروم رو داتا بدون برمجة واضحة، عكس الماشين ليرنينج اللي لازم الاكسبرتس تعمل selection for relevant feature manually. يعني الماشين ليرنينج الاكسبرتس هي اللي بتعمل لها selection للريليفنت فيتشر بطريقه مانيولي، انما الديب ليرنينج عندها القدره انها تعمل اوتوماتيك اكستراكت للريليفنت فيتشر فروم رو داتا بدون برمجه واضحه. طيب يبقى احنا كده قلنا ان الارتفيشال انتليجنس is the overarching system. الماشين learning is a subset of artificial intelligence. Deep learning is a subfield of machine learning, and neural networks make up the backbone of deep learning algorithms. طيب يبقى artificial intelligence when a computer mimic human intelligence to perform a given task. Machine learning a subset of AI that learns to perform given task from raw data and improves with experiences. إنما deep learning a subset of machine learning that uses large neural networks and big data to better solve complex problems. طيب إيه هي البيج داتا؟ احنا قلنا ان الديب ليرنينج بيستخدم اللارج نيورال نتوركس والبيج داتا عشان better solve الكومبلكس بروبلمز. ايه البيج داتا ديت؟ الترم بيج داتا is used in instance in which the data samples are too large to be adequately analyzed with traditional artificial intelligence methods. In this case, new methods such as deep learning can be used. يبقى deep learning بستخدمه إن هو بيقدر يعمل management للlarge volume of data اللي هي بنقول عليها big data. طيب إيه هو الديفرنس بين الماشين learning والdeep learning؟ Deep learning is an evolution of machine learning. Both are algorithms that use data to learn, but the key difference in how they process and learn from it. While basic machine learning models do become progressively better at performing their specific functions as they take in new data, they still need some human interventions. If an AI algorithm returns an inadequate prediction, then an engineer has to step in and make adjustments. With the deep learning models, an algorithm can determine whether or not a prediction is accurate through its own neural networks. This minimal to no human help is required. A deep learning model is able to learn through its own methods of computing عن طريق التكنيكس that make it seem like it has its own brain. كمان في differences بين الماشين learning والdeep learning إن الماشين learning consists of thousands of data points while the deep learning uses millions of data points. الماشين learning algorithm usually perform well with relatively small data sets. إنما قلنا deep learning requires large amount of data to understand and perform better than traditional machine learning algorithms. الماشين learning uses algorithms and learn on its own but may need human intervention to correct errors. With deep learning uses advanced computing, its own neural networks to adapt with little to no human interventions. يبقى artificial intelligence is a broad field that encompasses deep learning and machine learning. Its goal is to develop smart tools that can carry out cognitive functions زي problem solving, sentiment analysis of text to understand the sender's tone and emotions, decision making. Machine learning delivers accurate prediction and decisions by identifying patterns in its training data. With deep learning, a subset of machine learning. With this model, an algorithm can determine whether or not a prediction is accurate through a neural network without human interventions. Deep learning models can build extensive knowledge over time acting as a brain. طيب يبقى احنا قلنا ان الماشين ليرنينج عبارة عن branch of AI trained on statistical models and algorithms, which enable it to make prediction and decisions. Machine learning relies on human engineers to feed it relevant, pre-processed data to continue improving its outputs. It's adept at solving complex problems and generating important insight by identifying patterns in data. عن طريق إنها بتريسيف الداتا بتريسيف new information via user query, analyze the data, find a pattern, make a decision, and then send an answer back to the user. زي ايه example للماشين ليرنينج؟ زي الماشين ليرنينج زي ما قلنا الابلكيشنز اللي بتدي ريكومنديشن زي امازون، كمان قلنا زي السبوتيفاي، الابل ميوزك، اليوتيوب، كلهم بيريكومند new songs or artists to a listener. الماشين ليرنينج algorithm associate the listeners preferences زي saved songs، البلاي ليست، الفولود ارتست، السكيبت سونجز مع listener preferences مع other listeners who have similar musical tastes، وبيدوا recommendations بناء على recommendation لنيو سونج و recommendation لارتست و listener بناء على الاناليسيس دي ماشين example لماشين ليرنينج. إنما الديب ليرنينج عبارة عن sub field من الماشين ليرنينج that structure algorithm is in layer to create an artificial neural network that can autonomously learn and make intelligent decisions. بتشتغل ازاي؟ To use a deep learning model, a user must enter an input. It's then sent through the hidden layers of the neural network, where it uses mathematical operation to identify patterns and develop a final output اللي هو الريسبونس. The algorithm design pulls inspiration from the human brains and its network of neurons, which transmit information via messages. Algorithm receive data, runs it through the input and hidden layers, and generate an output. Example للdeep learning زي عندنا computer vision for driving. Deep learning models enable autonomous vehicles to recognize and respond to their surroundings, including identifying people, other vehicle, route signs اللي هي العربيات ذاتية القيادة. طيب يبقى احنا قلنا زي ما قلنا الارتفيشال انتليجنس، الماشين ليرنينج سب فيلد من الارتفيشال انتليجنس، والديب ليرنينج سب سيت من الماشين ليرنينج. وفي عندي الناتشورال لانجويج بروسيسنج، ده تايب من الارتفيشال انتليجنس. ايه الناتشورال لانجويج بروسيسنج دوت؟ ال NLP. Natural language processing is a branch of AI focused on enabling computers to understand, interpret, and generate human language in a way that is both meaningful and useful. Natural language processing techniques involves processing and analyzing large volume of text data to perform tasks such as text classification, sentiment analysis, translation, question answering, and text generation. من الapplication of natural language processing, الchatbot. Natural language processing is used to develop chatbot that can interact with user in natural language, providing information or assistance. الشات بوتس ده conversation بتحصل مع الماشين كأني بتعامل مع human بالظبط. التكست summarization, automatically generating summaries of long pieces of text. Speech recognition, converting spoken language into text. Question answering systems, systems that can answer questions posed in natural language. Information extraction اللي هي extracting relevant information from unstructured text data. اللي هي ايه unstructured text data؟ ايه structured data unstructured data؟ الأول structured data اللي هي الداتا اللي بنقول عليها highly organized and follow a predefined format. It's often represented in databases أو tables موجودين في rows and columns. بتبقى الريليشن بينهم واضحة جدا بين الاليمنتس وبعضيها. Easy to be analyzed، يبقى أي داتا مرتبة ما أقدر أحطها في tables في rows وcolumns، هقدر أعرف الريليشنز بينها وأقدر أعمل لها أناليسيس بطريقة سهلة. يبقى الإكزامبل للستراكشر داتا زي الداتا بيزز، زي السبريد شيتس، أي حاجة موجودة في إكسل في روز وكولمز ديت يتقال عليها structured data. طب إيه هي الانستراكشرد داتا اللي الناتشورال لانجويج بروسيسنج يقدر يعمل لها أناليسيس؟ الانستراكشرد داتا بتبقى الداتا lacks a predefined structure or clear organization، زي داتا موجودة في text، في images، audio، videos. أقدر أعمل لها أعرف الريليشنز بينهم وبين بعض إزاي؟ أقدر أعمل لها analysis إزاي؟ الاناليسيس بتاعها بيبقى very complicated، صعب ان انا اعرف الريليشن بين ال predefined structures وبعضيها. example لل unstructured data قلنا الايميلز، الارتكلز، الريبورتس، textual content، اي مالتي ميديا فايل زي الايمج، الفيديو، الاوديو فايلز، السوشيال ميديا بوست، الكونتنت فروم سوشيال ميديا بلاتفورمز، كل ديت unstructured data. natural language processing يقدر يعمل information extraction، يعمل extracting the relevant information from unstructured text data. طيب يبقى احنا اتكلمنا في الارتفيشال انتليجنس يعني ايه AI، يعني ايه ماشين ليرنينج وده نوع من انواع الاي اي، والديب ليرنينج ده نوع سبست من الماشين ليرنينج، واتكلمنا عن الناتشورال لانجويج بروسيسنج ده نوع من انواع الاي اي. طب ايه الارتفيشال انتليجنس في الهيلث كير؟ الاي اي في الهيلث كير بيشتغل ازاي؟ الاي اي في الهيلث كير بيجمع معلوماته منين؟ عن طريق الانفورميشن شيرنج، هو اللي بيغذي الاي اي. اي معلومه بتدخل على الانترنت عن طريق نشر evidence based guidelines، clinical protocols، شات بين الاطباء وبعضها، شيرنج للمعلومات الطبيه عن حاله مرضيه سواء كانت written او voice chat او فيديو كونفرنس او الكترونيك ميل، كل ده بالاضافه للالكترونيك ميديكال ريكوردز. كل المعلومات الكتيرة ديت اللي بالملايين اللي بيتقال عليها big data، هي large volume of data، بيتعمل لها processing وanalysis عن طريق ال AI machine اللي بتعمل prediction. يعني بناء على المعلومات المتاحة على الإنترنت بيقدر ال artificial intelligence machine تتنبأ بمعلومات تقدر تطور الهيلث كير سيستمز. طيب ابتدى ازاي الهيلث كير الاي اي في الهيلث كير؟ ف 1980 ابتدى الاكسبرت سيستم based on collection of if then rules where the dominant technology for AI is in the 1980 and were widely used commercially in that and later period. في الهيلث كير they were widely employed for clinical decision support purposes over the last couple of decades and are still in wide use today. Many electronic health records provide furnish a set of rules with their system today. بعد كده جه if then rule، rule based expert system. expert system require human experts and knowledge engineers to construct a series of rules in a particular knowledge domain. They work well up to a point and are easily to understand. However, when the number of rules is large and the rules begin to conflict with each other, they tend to break down. Moreover, if the knowledge domain changing the rule can be difficult and time-consuming. They are slowly being replaced in healthcare and more approach based on data and machine learning algorithm. The emergence of AI in healthcare has been groundbreaking, reshaping the way we diagnose, treat, and monitor patients. And AI in healthcare began with the digitalization of medical records and the development of expert systems that could assist in the diagnostic process. The combination of advanced algorithms, increased computing power, and the availability of vast healthcare data open up a new horizon. AI has become a game changer in health care. في applications of AI في ال population health. ال AI application in population health span various domains using advanced analytics, machine learning, and automation to improve health outcomes, enhance healthcare delivery, and support public health efforts. هنتكلم عن ال key application of AI في ال population health. في ال predictive analytics في ال disease outbreak prediction. في عندنا AI models تقدر تعمل analysis للداتا from various sources زي electronic health record, السوشيال ميديا, travel patterns to predict potential disease outbreaks and their likely spread. كمان في chronic disease management. AI can predict which patients are at high risk of developing chronic diseases like diabetes, hypertension, heart disease, enabling early interventions and tailored prevention programs. يبقى ال AI بيساعدني في ال predictive analytics. رقم 2 في ال personalized medicine. Treatment recommendations. ال AI algorithm can analyze genetic, clinical, and lifestyle data to recommend personalized treatment plans that are more likely to be effective for individual patients. كمان في ال drug response prediction, ال machine learning models can predict how patients will respond to specific medication based on their genetic profiles and other factors, reducing trial and error in treatment. كمان في ال population health monitoring, ال health trend analysis. AI can analyze large data sets to identify emerging health trends and patterns, helping public health officials make informed decisions about where to focus resources. كمان في real-time surveillance, AI systems can provide real-time surveillance of health data, quickly identifying anomalies that may indicate the onset of a health crisis, such as a flu epidemic or bioterrorism event. Health behavior insight, behavioral interventions. AI can analyze data from wearable devices, applications, and social media to understand health behaviors and design personalized interventions to promote healthier lifestyle. Adherence monitoring. AI can track medication adherence and send reminders to patients, helping improve compliance with treatment regimen. Healthcare resource allocation, optimizing resource use. AI can predict healthcare demand and optimize the allocation of resources like hospital beds, medical staff, equipment, ensuring they are available where needed most. Supply chain management. AI can enhance the management of healthcare supply chains, ensuring timely availability of medications, vaccines, and other critical supplies. Improving health equity. Identifying disparities. AI can analyze social determinants of health and other data to identify health disparities across different population groups. Targeted interventions. Based on these insights, public health authorities can design and implement interventions specifically aimed at reducing health disparities and promoting equity. Clinical decision support. Diagnosis assistance. AI can support healthcare providers by analyzing patient data to assist in diagnosing diseases more accurately and quickly. Treatment planning. AI tools can provide recommendations for treatment plans based on the latest clinical guidelines and patient-specific factors. في health education and outreach. Personalized health education. AI-driven chatbot and virtual assistants can provide personalized health education and information to individuals, helping them make informed health decisions. In public health campaigns, AI can optimize the design and delivery of public health campaigns by targeting message to specific demographics based on their behavior and preferences. Research and development. Accelerating research. AI can analyze vast data set from clinical trials and other research studies, identifying potential new treatments and speeding up the research process. في epidemiological studies, AI can enhance the design and analysis of epidemiological studies, providing deeper insight into the factors affecting population health. Operational efficiency. Automation of routine tasks. AI can automate routine administrative tasks such as scheduling, billing, data entry, freeing up healthcare providers to focus more on patient care. في quality improvement, AI can continuously monitor healthcare process and outcomes, identifying areas for improvement and ensuring high standards of care. يبقى احنا كده قلنا ان AI من الابليكيشن of AI في population health في predictive analytic في personalized medicine في population health monitoring health behavior insight health care resource allocation improving health equity في clinical decision support في health education and outreach في research and development وفي operational efficiencies. آخر حاجة هنتكلم عن examples of AI في population health. عندنا IBM Watson Health في oncology. في Watson's for oncology uses AI to provide evidence-based treatment options for cancer patients by analyzing medical literature and patient data. وفي population health insights كمان Watson Health provides analytic solutions that help identify population health trends and inform public health strategies. في كمان عندنا Google Deep Mind Health. في الميديكال imaging Deep Mind Health uses AI to analyze medical images, improving the accuracy of diagnosis and speeding up the process. في predictive healthcare Deep Mind's AI algorithm can predict patient deterioration, potentially preventing hospital readmission and improving patient outcomes. وفي Microsoft AI for Health في pandemic response Microsoft's AI for Health initiatives support projects that use AI to track and respond to pandemic including COVID-19. وفي genomic research ال AI tools are used to analyze genomic data, aiding in the understanding and treatment of various diseases. ال AI application in population health are diverse and powerful, offering the potential to transform how we understand, monitor, and improve health outcome on a larger scale. By using AI capabilities in predictive analytic, personalized medicine, health behavior insight, resource allocation, we can create more effective and efficient health system and benefit entire population. Thank you very much. أشكر حضراتكم. لو في أي حاجة ما كانتش واضحة في السيشنز بتاعتنا أستأذن حضراتكم ابعتولي في الشات. ناخد بريك دقيقة ونرجع تاني إن شاء الله مع بعض نفتح البرزنتيشن اللي جاي. Thank you very much. مساء الخير. نكمل مع حضراتكم. بنتكلم النهاردة عن بروجرام AI Powered Population Health. Learning Outcomes. اتكلمنا في السيشن اللي فاتت عن الرول of AI in Population Health. هنتكلم في السيشن دي عن Big Data and its role in Population Health. Understanding Big Data and its role in Population Health. يعني إيه Big Data؟ Big data refers to extremely large data sets that may be analyzed computationally to reveal patterns, trends, and association, especially relating to human behaviors and interactions. In the context of population health, big data encompasses a wide range of data sources, including electronic health records, social media interactions, wearable device data, environmental data, and more. Big data في population health. In population health, big data refer to the collection, integration, and analysis of vast amount of health-related data from various sources to improve understanding, prediction, and management of health outcomes at a population level. This approach allows healthcare professionals, researchers, and policymakers to gain deeper insight into health trends, identify risk factors, optimize interventions, and allocate resources more effectively. Example, imagine a scenario where a public health agency wants to understand and mitigate the spread of a contagious disease in a city. Here's how big data could be utilized. A data source, the agency collects data from multiple sources, including electronic health records from hospitals, clinics, detailing patient diagnosis and treatment, public health surveillance data on reported cases of the diseases, social media and internet search data to monitor public sentiment and behavior related to the disease, environmental data such as air quality, weather patterns, which may affect the disease transmissions. All this data will be integrated. Big data technologies are used to integrate these diverse data sets, overcoming challenges of data format and structures. Analysis of this data is very complicated. Analysis of this integrated data. Predictive modeling identifies geographic areas at higher risk of disease transmission based on demographic, environmental, and health data. Temporal analysis detects patterns in disease outbreak and identify potential triggers. Sentiment analysis of social media data provides insight into public perceptions and compliance with preventive measures. And then you need to make decisions. Informed decision-making process. Public health interventions are designed and targeted to specific population or geographic area. Resource allocations is optimized based on predicted disease trends and population health needs. And then we need to make monitoring and evaluation. A continuous monitoring of data allows for real-time adjustment to intervention and strategies as new data becomes available. In conclusion, big data in population health enables a more comprehensive and dynamic approach to understanding and managing health at a population level, using the power of large-scale data analysis to improve health outcomes and promote public well-being. Understanding big data and its role in population health, big data plays a very important role in population health by offering insights and solutions that were previously unattainable with traditional data processing methods. هنتكلم أول حاجة وأهم حاجة عن الداتا collection. Big data encompasses vast amount of structured and structures زي electronic health record و unstructured data قلنا زي medical media post, wearable device data from diverse sources such as healthcare providers, public health agency, social services, and personal devices. Big data plays a significant role in data collection within the field of population health by making a revolution of high, diverse, and extensive data sets are gathered, integrated, and utilized. هنتكلم عن ال aspects of data collection, diverse data sources, with real-time data collection. في ال diverse data sources of big data في population health, big data in population health draws upon a wide array of diverse data sources encompassing traditional healthcare records to novel sources like social media, environmental sensors. Here are some examples of diverse data sources used in big data application within population health. Electronic health records. Electronic health records contain detailed patient information collected by healthcare providers, including the medical history, diagnosis, treatments, prescriptions, laboratory results. Electronic health records are fundamental for understanding individual health profiles and treatment histories, supporting clinical decision-making and aggregating data for population-level analysis. Public health surveillance data. Surveillance data consists of information gathered by public health agencies to monitor and respond to disease outbreaks, health trends, and risk factors at local, regional, and national levels. It provides crucial insights into disease incidence, prevalence, and distribution, aiding in early detection of outbreaks and guiding public health interventions. Social determinant of health. Social determinant of health data includes socio-economic factors زي الانكم والeducation. في environmental conditions زي الhousing quality والaccess to green spaces زي community resources, health access والsocial support networks. Understanding the social determinant of health helps identify disparities in health outcomes and inform strategies to address social and environmental determinants that influences population health. Behavioral data. Behavioral data encompasses information on individual behaviors related to health, including physical activity levels, dietary habits, substance use, and adherence to medical treatments. Analyzing behavioral data helps in understanding lifestyle factors contributing to health outcomes and designing targeted intervention for behavior change. Environmental data includes measurements of air quality, water quality, climate conditions, and other environmental factors that impact health. Integrating environmental data with health data helps assess environmental health risks, study the effects of environmental exposure on health outcomes, and develop strategies to mitigate environmental health hazards. كمان من data sources genomic and biomedical data. Genomic data involves the genetic information obtained from individuals to study genetic variation, predisposition to diseases, and responses to treatment. Genomic data supports personalized medicine approach, identify genetic risk factors for diseases, and inform precision medicine strategies tailored to individual genetic profiles. الموبايل health أو الM health and wearable devices. Data collected from mobile applications and wearable devices such as fitness trackers, smartwatches, and medical sensors that monitor physiological parameters زي الهارت rate, sleep patterns. These devices provide real-time health data, promote continuous monitoring of health metrics, and facilitate remote patient monitoring, enhancing personalized healthcare and disease management. Social media and internet data. السوشيال ميديا platforms, الأونلاين forums, الإنترنت search generate vast amount of data related to health behaviors, disease perceptions, and public sentiment. Analyzing social media and internet data helps track public health trends, monitor health-related discussions, and assess the impact of health campaigns and intervention in real time. These diverse data sources collectively contribute to a holistic understanding of population health, enabling healthcare providers, researchers, and policymakers to identify health disparities and to predict health outcomes and develop targeted interventions that improve overall public health and well-being. تاني حاجة قلنا هنتكلم عنها في الداتا collection الريل تايم data collection of big data in population health. Real-time data collection in population health refer to the continuous acquisition, processing, and analysis of data as it becomes available, enabling timely insight and responses to health-related events and trends. هنتكلم عن examples of real-time data و aspects of real-time data collection using big data في population health زي sensor networks and IoT Internet of Things devices. Sensors network and Internet of Things devices collect real-time data from various sources such as environmental sensors زي air quality, water quality, wearable devices زي fitness tracker والميديكال monitors وزي ما بيجمع برضو الداتا من الميديكال equipment اللي بتقيس لنا الفيتال ساينس اللي بتعمل monitoring للفيتال ساينس. These devices provide continuous monitoring of health metrics, environmental conditions, and patient activities, facilitating early detection of anomalies or changes in health status. كمان electronic health records. While electronic health records primarily store historical patient data, real-time interfaces and integration with healthcare systems allow for update in real time, such as new test results, medication change, or patient admission. Real-time access to electronic health records support clinical decision-making والcare coordination والsurveillance of health event within healthcare facilities. الsyndromic surveillance system. الsyndromic surveillance system بيعمل monitoring للreal time data from emergency department visits, urgent care centers, and other healthcare facilities to detect patterns suggestive of disease outbreak and public health emergencies. These systems enable early warning and rapid response to potential health threats, enhancing public health preparedness and response capabilities. Social media and internet monitoring. Real-time monitoring of social media platforms والأونلاين forums والإنترنت search allows for tracking of public health concerns, disease symptoms, health related behaviors. Analyzing real-time social media data provides insight into public sentiment, perception of health risks, and emerging health trends, informing targeted intervention and communication strategies. كمان الموبايل health applications. الموبايل health application collect real-time data on user behaviors, health metrics زي physical activity, sleep patterns, and self-reported symptoms or conditions. This application enable continuous monitoring of individual health, support remote patient management, and facilitate real-time feedback and intervention for chronic disease management and preventive care. Public health reporting systems. Real-time reporting systems allow healthcare providers and public health agencies to report notifiable diseases, outbreaks, and health events promptly. Timely reporting and aggregation of data support surveillance, epidemiological interventions, and the implementation of targeted control measures to prevent further spread of infectious diseases and other health threats. كمان environmental monitoring system. Real-time environmental monitoring systems collect data on air quality, water quality, weather conditions, and other environmental factors that impact health. These systems provide continuous updates on environmental health risks, facilitate early detection of environmental hazards, and inform public health responses and interventions. Real-time data collection in population health is very essential for enhancing situational awareness, improving response times to health emergencies, and supporting proactive healthcare delivery and public health interventions. By using big data technologies and real-time analytics, healthcare stakeholders can better understand health dynamics, predict health outcomes, and optimize resource allocation to improve population health outcomes. علشان برضو نتكلم عن البيج داتا and its role في population health. بعد ما اتكلمنا عن الداتا collection لازم نتكلم عن scalability and volume handling. Big data infrastructure can handle massive volume of data efficiently. This scalability is very important as the volume of health-related data continues to grow exceptionally, particularly with the advent of wearable devices and Internet of Things technologies. Scalability and volume handling are critical aspects of big data in population health, as they enable the processing, storage, and analysis of vast amount of data from diverse sources. هنتكلم عن ازاي how scalability and volume handling are managed in the context of big data application in population health. Data collection from multiple sources. Big data technologies are designed to handle data collection from numerous sources simultaneously, including electronic health records, public health surveillance systems, environmental sensors, social media platforms, and mobile health devices. These technologies can manage large volumes of data generated in real time or collected over expanded periods, ensuring continuous data flow without overwhelming processing capabilities. Storage infrastructures. Big data solution employs scalable storage infrastructures such as distributed file system that can seamlessly expand to accommodate growing datasets. These systems are capable of storing data, ensuring that all collected data is retained for long-term analysis and historical comparisons. Data processing and analysis. Distributed computing framework enable parallel processing of large datasets, allowing for efficient data processing and analysis. By distributing computational tasks across a cluster of servers, big data platforms can handle complex analytics on massive datasets in a reasonable time frame, maintaining performance and scalability. Real-time analytics. Stream processing frameworks support real-time data ingestion and analytics, enabling continuous monitoring and analysis of streaming data from sources like Internet of Things devices and social media. These frameworks are designed to handle high-volume data stream with low latency, ensuring timely insight and responses to dynamic health-related events and trends. Machine learning and AI application. Big data platforms integrate machine learning and AI algorithms that can scale to process and learn from large datasets, improving predictive modeling and personalized medicine application. Advanced analytics techniques such as deep learning and ensemble methods are applied to big data to derive actionable insight from complex, high-dimensional data structure. Cloud computing and elasticity. Cloud computing services provide elastic scalability, allowing organizations to dynamically scale computing resources up and down based on demand. A cloud-based big data solution uses distributed computing and storage capabilities of cloud platform to handle massive datasets and accommodate fluctuation in data processing requirement efficiently. In summary, scalability and volume handling are essential capabilities of big data in population health, enabling healthcare organizations, researchers, and public health agencies to manage, analyze, and derive meaningful insight from large and diverse datasets. These capabilities support data-driven decision-making, personalized health intervention, and proactive health management strategies to improve population health outcome. اتكلمنا عن الداتا كولكشن، السكالابيليتي اند فوليوم هاندلنج. هنتكلم عن الداتا انتجريشن اند interoperability. Big data solution facilitates the integration of disparate data sets from various sources, overcoming the changes of data silos and ensuring interoperability. This integration allows for a more comprehensive view of population health, capturing both health-related and non-health-related determinants. Data integration and interoperability are very important aspects of big data in population health, ensuring that diverse data sets from various sources can be combined, analyzed, and utilized effectively. هنتكلم عن how data integration and interoperability are managed in the context of big data application في population health. Definition والimportance. data integration. Data integration involves combining data from different sources and format into a unified cohesive data sets. طيب يعني ايه interoperability؟ Interoperability refers to the ability of different systems and data sets to work together, enabling data exchange, sharing, and usability across diverse platforms and applications. Sources of data in population health عندنا من sources of data في population health electronic health records, public health surveillance system, environmental والsocial determinant, behavioral والlifestyle data. ايه هي challenges in data integration and interoperability؟ data integration and interoperability is big data application within population health, faces several significant challenges from the diversity of data sources, varying format, and the need to ensure data quality, security, and compliance. من challenges data silos and fragmentation. Data often resides in isolated silos within different systems, departments, or organization, making this very difficult to access and integrate across the healthcare ecosystem. Fragmented data inhibit comprehensive analysis and decision-making, leading to incomplete insights into population health trends, patient outcomes, and healthcare utilization. Diverse data format and standards. Data is collected in various forms. Example, structured, unstructured, semi-structured form, and may adhere to different standards or lack standardization altogether. Incompatibility between data formats and standards complicate integration efforts, requiring additional resources for data transformation, mapping, and normalization to ensure consistency and accuracy. Data quality and accuracy. Variation in data quality, completeness, and reliability across different sources, زي error, duplicates, missing values, pose challenges to integrating reliable and actionable data. Poor data quality undermines the validity and usefulness of integrated datasets, leading to error in conclusions, ineffective decision-making, and compromised patient care outcomes. Privacy and security concerns. Healthcare data, including sensitive patient information, must adhere to strict privacy regulation and stringent security measures to protect against unauthorized access, breach, and data misuse. Addressing privacy and security requirements adds complexity to data integration efforts, requiring robust encryption, access controls, and compliance framework to safeguard patient confidentiality and trust. Interoperability across systems and technologies. These challenges arise from the need to enable seamless data exchange and communication between disparate healthcare IT systems, platforms, and applications. Lack of interoperability limits data sharing and collaboration among healthcare providers, hindering care coordination, continuity of patient information, and interoperable health information exchange initiatives. Scalability and performance. As data volume continue to grow, scalability become very important to support the storage, processing, and analysis of large data set within acceptable timeframes. Inadequate infrastructure and computational resources may lead to performance bottlenecks, delays in data processing, and compromised real-time analytics capabilities, affecting decision-making and responsiveness in population health management. Complexity of integration projects. Integrating diverse data sources and systems require significant planning, resources, expertise across technical, organizational, and governance domains. Complex integration projects may face delays, budget overruns, and challenges in stakeholders' alignment, necessitating comprehensive project management strategies and collaborative partnership to achieve successful outcomes. Addressing these challenges require concerned efforts from healthcare organizations, technology providers, policymakers, and regulatory bodies to foster data standardization, enhance interoperability frameworks, implement robust data governance practice, and invest in scalable infrastructure and advanced analytic capabilities. By overcoming these hurdles, stakeholders can unlock the full potential of big data in population health to drive actionable insights, improve healthcare outcomes, and promote equitable and efficient healthcare delivery. A technological solution for data integration and interoperability in population health are very essential to overcome the challenges posed by diverse data source format and standards. The benefit application of data integration and interoperability. Data integration and interoperability in population health offer numerous benefits and enable various applications that enhance healthcare delivery, research capability, and public health outcomes. The benefit of the application is comprehensive patient care and coordination. Integrated health data allows healthcare providers to access comprehensive patient profiles, including medical history, treatment plans, and recent test results from multiple sources. Facilitate coordinated care across healthcare settings, like hospitals, clinic, primary care, improving care quality, patient safety, and continuity of care. Enhanced clinical decision-making. Access to integrated clinical data supports evidence-based decision-making by providing timely insight into patient condition, treatment outcomes, and adherence to care protocols. Enable healthcare providers to personalize treatment plans, monitor patient progress, and optimize clinical workflow based on real-time and historical data. Improve the public health surveillance and response. Integration of public health data زي disease surveillance, زي environmental health, social determinants, enable early detection of disease outbreaks, monitoring of population health trends, and rapid response to public health emergencies. Support proactive public health interventions, resource allocation, policy making to mitigate health risk and promote community well-being. Population health management. Aggregate analysis of integrated health allow for population level assessment of health trend disparities and risk factor, enable population health management strategies such as risk stratification, predictive modeling for disease prevention, and targeted intervention to improve health outcomes and reduce healthcare costs. Research and innovation, access to integrated research data زي الكلينيكال ترايل، genomic data، patient registries, foster collaborative research efforts, promote data-driven discoveries, and accelerate biomedical advancements, support translation research, prediction medicine initiatives, and development of new therapies, diagnostics, and healthcare technologies. كمان في efficient healthcare operation and cost management. Streamline data integration and interoperability, reduce administrative burden, data redundancies, and efficiencies in healthcare operation. Enhances resource utilization, binding accuracy, and financial forecasting, contributing to cost-effective healthcare delivery and sustainable healthcare system. وفي البيشنت empowerment and engagement, integrated health data empowers patients with access to their own health information, promoting active participation in care decision and self-management. Support البيشنت portal, الموبايل health application, telehealth services that improve communication between patient and healthcare providers, enhance care coordination, and promote health literacy. Regulatory compliance and data security, adherence to interoperability standards and data governance framework ensure data privacy, security, and compliance with regulation requirements. This protects patient confidentiality, mitigate data breach, and builds trust among stakeholders in the secure exchange and use of health information. In summary, data integration and interoperability play an important role in transforming healthcare delivery and public health practices by enabling seamless data exchange, enabling decision-making capabilities, promoting collaboration among stakeholders, and ultimately improving health outcome for individuals and population alike. In conclusion, data integration are essential capabilities of big data in population health, enabling organization to harness the full potential of diverse data sets for improving health outcome, addressing health disparities, and advancing public health initiatives. يبقى احنا علشان نتكلم عن البيج داتا and its role في population health، اتكلمنا عن الداتا collection، السكالابيليتي and volume handling، الداتا integration and interoperability، والadvances analytic and insights. Big data analytics, including machine learning and AI techniques, are applied to analyze integrated data sets. These analytics can identify patterns, trends, correlation, and predictive models that provide deeper insight into population health dynamics, disease risk factors, and healthcare outcomes. Advanced analytics and insight derived from big data in population health enable healthcare organizations, researchers, and policymakers to use vast amount of data for predictive modeling, risk stratification, personalized medicine, and evidence-based decision-making. Here is how advanced analytics contribute to extracting meaningful insight from big data in population health. عن طريق predictive modeling and risk stratification. Advanced analytics techniques زي machine learning, AI algorithm analyze historical and real-time data to predict future health outcomes, disease risks, and healthcare utilization patterns. predictive models identify individuals at high risk of developing chronic conditions زي الديابيتس, cardiovascular diseases, enabling early intervention, preventive care strategies, and resource allocation for targeted population health management. في precision medicine and personalized healthcare, analyzing genomic data, clinical profiles, and behavioral factors using advanced analytics facilitate personalized medicine approach, tailors treatment plans and intervention to individual patient characteristics, genetic predisposition, and responses to therapies, in improving treatment efficacy, patient outcome, and reducing adverse events. Real-time monitoring and disease surveillance. Real-time analytics processes streaming data from wearable devices من Internet of Things sensors and social media platforms to monitor health metrics, detect disease outbreaks, and track epidemiological trends. This enables timely public health interventions, early detection of infectious diseases, and adaptive response strategies to emerging health threats, enhancing population health surveillance and emergency preparedness. كمان في population health analytics, aggregate analysis of integrated health data زي electronic health records, claim data, social determinants, identify potential levels, health trends with disparities, and socioeconomic factors influencing health outcomes. This informs population health management strategies, policy development, and resource allocation for addressing health inequities, improving preventive care initiatives, and optimizing healthcare delivery models. في clinical decision support systems, integrates clinical guidelines with evidence-based practices and patient-specific data to provide actionable insight and recommendation to healthcare providers at the point of care. This enhances diagnostic accuracy, treatment decision-making, and adherence to clinical best practices, reducing medical errors and improving patient safety and quality of care. Natural language processing and text meaning. Analysis, unstructured data from clinical notes, research literature, and patient surveys using natural language processing and text mining technique to extract valuable insights and patterns. This can support clinical research, literature reviews, and knowledge discovery by uncovering hidden relationships, identifying new therapies, and validating clinical hypotheses from textual data sources. Healthcare operation and financial analytics. Analysis operation data زي hospital admission, resource utilization, billing data, and financial metrics to optimize healthcare operations, manage cost, and improve revenue cycle management. Visual analytics and data visualization utilizes interactive dashboard, graphs, and visual representation to explore and communicate complex healthcare data, facilitating data exploration, pattern recognition, and decision support. This enhanced data-driven insight facilitates stakeholder engagement and promote knowledge sharing among healthcare professionals and researchers and policymakers. In conclusion, advanced analytics powered by big data play a transformative role in population health by enabling evidence-based decision-making and personalized healthcare delivery, proactive disease management, and improved health outcomes. By harnessing the full potential of advanced analytics, stakeholders can address healthcare challenges more effectively, drive innovative in healthcare practices, and ultimately improve the health and well-being of individuals and communities. اتكلمنا عن الرول of big data in population health، عن الداتا collection، scalability and volume handling، الداتا integration and interoperability، advanced analytic and insight. هنتكلم عن personalized and precision medicine. By using big data, healthcare providers can develop personalized treatment plans based on individual patient data, genetic profiles, and lifestyle factors. This approach supports precision medicine initiatives aimed at improving health outcomes and reducing healthcare costs. هنتكلم عن personalized medicine والprecision medicine. personalized medicine من الابليكيشنز بتاعته genomic and molecular data analysis. Big data analytics analyze genetic information زي DNA sequencing data to identify genetic variation والbiomarkers والmutation associated with diseases or drug responses. This enables genetic profiling for personalized risk assessment and disease prevention and targeted therapies based on individual genetic profile. Clinical and phenotypic data integration. Integrate clinical data, example electronic health records, lab test, imaging with patient demographic, lifestyle factors, and environmental data. This can create comprehensive patient profile to personalize treatment plans, predict disease progression, and optimize healthcare management strategies tailored to individual health needs and preferences. Machine learning and predictive modeling. Machine learning algorithms analyze large data sets to identify patterns, to predict health outcomes, and stratify patient population based on risk factors and predictive analytics. This can support early disease detection, prognosis assessment, and personalized care planning by predicting individual health trajectories and optimizing preventive interventions. Remote patient monitoring and Internet of Things devices utilizes data from wearable device, Internet of Things sensors, and mobile health applications to continuously monitor patient health metrics زي الهارت ريت، الجلوكوز ليفل، physical activities. This can facilitate remote patient management, real-time health monitoring, and personalized feedback to promote self-management, adherence to treatment plans, and early intervention for high-risk individuals. طيب precision medicine في عندنا targeted therapies and treatment optimization utilizes molecular profiling and biomarkers identification to match patients with specific therapies or clinical trials that target the molecular drivers of this disease. This improves treatment efficacy, reduces the adverse effects, and enhances patient outcomes by selecting therapies based on genetic, molecular, and biomedical characteristics of the disease and individual patient response. Population genomic and public health genomic. applies genomic and molecular data at a population level to understand disease prevalence, genetic predisposition, and population-specific health risks, informs public health strategies, genetic screening programs, and preventive interventions tailored to population subgroups based on genetic and environmental risk factors. Data integration for evidence-based medicine. Integrate diverse data sets to generate evidence for clinical decision-making, treatment guidelines, and healthcare policies. To improve precision in healthcare delivery. Collaborative research and clinical trials. Facilitate collaborative research initiatives and clinical trials by integrating multi-omic data, patient registries, and healthcare databases to study disease mechanism, treatment responses, and therapeutic outcomes. This accelerates discovery of biomarkers, drug targets, and personalized therapies through data-driven research collaboration, fostering innovation in precision medicine and translational research. البنفيت والإمباكت بتاع البريسيجن ميديسن enhanced treatment outcomes. Personalized and precision medicine improve treatment outcomes by tailoring therapies to individual genetic profile, reducing adverse effect و-optimizing treatment efficacy. تاني حاجة patient centered care empowers patients with personalized health information with treatment options and proactive management strategies, promoting active engagement and adherence to personalized care plan. Cost efficiency reduces healthcare cost by avoiding ineffective treatment, minimizing hospitalization, and optimizing resource allocation through targeted intervention and preventive care. In conclusion, big data-driven, personalized, and precision medicine making a revolution in healthcare by harnessing vast data sets to deliver individualized care, improve health outcomes, and advance our understanding of disease mechanism at both individuals and population levels. Continued advancement in data analytics, genomic, and healthcare technologies are pivotal in realizing the full potential of personalized and precision medicine in population health. علشان تبان لنا الصورة بتاعت ونفهم البيج داتا والرول بتاع البيج داتا في البوبوليشن هيلث، اتكلمنا عن الداتا كولكشن، السكالابيليتي اند فوليوم هاندلنج، الداتا انتجريشن اند انتروبرابيلتي، الادفانسد اناليتيك اند انسايت، personalized and precision medicine، وهنتكلم عن البابليك هيلث سيرفيلانس اند ريسبونس. السيرفيلانس هنتكلم عن السيرفيلانس، هنتكلم عن الريسبونس. Big data enhances public health surveillance by enabling rapid detection of disease outbreak, monitoring population health trends, and evaluating the effectiveness of public health interventions. How big data is utilized in public health surveillance في public health عن طريق early detection of outbreaks and disease surveillance. Integrated data from various sources such as electronic health record, syndromic surveillance system, laboratory reports, and social media, uses real-time data analytics and machine learning algorithms to detect unusual disease patterns, spikes in symptoms, or geographic cluster indicating potential outbreaks. They enable the early warning system, rapid detection of infectious disease, زي الفلو فيروس، زي الزيكا فيروس and proactive response measures to mitigate the spreads and impacts. في السيندروميك surveillance and real-time monitoring integrate syndromic data from emergency department, urgent care centers, and healthcare facilities to monitor the trends in patient symptoms and health conditions. Applies predictive analytics and anomalies detection to identify emerging health threats, monitor disease trends, and assess the effectiveness of public health intervention. زي support situational awareness, public health decision making, resource allocation أثناء public health emergencies. في environmental monitoring and health impact assessment بتintegrate environmental data زي air quality, water quality, climate data with health outcomes and population health indicators. يتعمل analysis للenvironmental exposure and their potential health impact using spatial analysis with geographic information system and remote sensing technologies. زي ما أثناء facilitate environmental health surveillance و identify environmental health risk زي pollution related diseases and inform environmental policies and interventions. والbehavioral and social determinant surveillance integrated data on social determinant of health and behavioral factors apply data mining and patterns recognition technique to understand social and behavioral trends influencing health outcomes and disparities support targeted health promotion programs, community health assessment and intervention addressing the social determinant to improve population health equity. في public health response زي real time decision support and situational analysis. Use real time data streams and dashboard to monitor health indicator, access community health needs and track intervention outcomes to enhance the situational awareness during the outbreak, emergencies, and public health crisis, facilitating a coordinated response effort across the healthcare agency and stakeholders. في surveillance data integration and interoperability integrated diverse data sets زي clinical data والdemographic data والenvironmental data to create comprehensive surveillance system. To improve the data quality with timeliness of reporting and coordination of surveillance activities, enabling collaborative efforts in disease control, prevention, في emergency preparedness. وفي predictive modeling and risk assessment apply predictive modeling techniques to forecast disease trends, to assess population vulnerabilities, and stimulate the impact of intervention. support proactive public health strategies with contingency planning and adopting response measures to mitigate health threats and protect community health. وفي global health surveillance and cross-border collaboration facilitate international data sharing, collaboration, and surveillance networks to monitor global health threats زي infectious diseases في pandemics. طبعا دي strengthen global health security, facilitate early warning systems for international health emergencies, and enhances preparedness for cross-border health challenges. In summary, big data-driven public health surveillance and response system enable proactive monitoring, rapid detection, and effective management of health risk and emergency. By using advanced analytic real-time data streams and interdisciplinary collaboration, public health agency can enhance their capacity to protect population health, respond to emerging threats, and promote health equity on a local, national, and global scale. Big data transform data collection in population health by expanding the scope of available data sources, improving data quality and accessibility, enhancing analytical capabilities, and supporting evidence-based decision-making in healthcare and public health policies. This enables more effective and efficient approach to improving population health outcomes and addressing health disparities. اتكلمنا عن الرول بتاع البيج داتا في الداتا كولكشن، السكالابيليتي and volume handling في الداتا انتجريشن، في الادفانسد اناليتكس اند انسايت، في البيرسوناليزد والبريسيجن ميديسن، وفي البابليك هيلث سيرفيلانس اند ريسبونس. أشكر حضراتكم. لو في أي حاجة مش واضحة أستأذن حضراتكم ابعتوا لي على الشات. Thank you very much. ناخد بريك دقيقتين ونرجع مع حضراتكم السيشن اللي جاية إن شاء الله. السلام عليكم. بنكمل البروجرام بتاعنا النهاردة عن ال AI Powered Population Health مع حضراتكم دكتورة ماريا حبيب، ماجستير إدارة جودة الرعاية الصحية من المعهد العالي للصحة العامة جامعة اسكندرية. اتكلمنا في السيشن الأولى عن الرول of AI in Population Health. في السيشن الثانية فهمنا يعني إيه بيج داتا وإيه الرول of بيج داتا في البوبوليشن هيلث. هنتكلم في السيشن دي عن الماشين ليرنينج فاندامنتالز فور population health professionals. population health professionals are individuals who work within the field of public health and healthcare to improve the health outcomes and well-being of specific groups or populations. Their work typically focuses on understanding and addressing the health needs of entire population rather than individual patients. هنتكلم عن ال definition of population health. زي ما قلنا إن health outcomes of a group of individuals, including the distribution of such outcomes within the groups. It involves understanding the health of population through the patterns of health determinants and using that knowledge to improve health. إيه هي ال key responsibilities of population health professionals? Population health professionals have a wide range of responsibilities aimed at improving the health outcomes and well-being of entire population. Their responsibility encompass various domains, including public health, healthcare management, policy development, and community engagement. Here are key responsibilities of population health professionals. أول حاجة health assessment and surveillance, conducting comprehensive assessment of the health status, needs, and behaviors of specific population, monitoring health trends and patterns through data collection and analysis such as epidemiological studies and health surveys, policy development and advocacy, developing and recommending policies and interventions that promote health equity and address population health disparities, advocating for policies that support preventive health, access to healthcare services, and social determinant of health. Program planning and evaluation, designing, implementing, and evaluating health promotion programs and interventions tailored to meet the need of diverse population, assessing the effectiveness and impact of programs on health outcomes and adjusting strategies as needed. Community engagement and education, collaborating with community stakeholders, including resident community organization, healthcare providers, and local authorities, educating the community about health risks, prevention strategies, and available resources to improve health literacy and empower individuals to make informed decisions. Health data management and analysis, utilizing health data systems to track population health indicators, outcomes, and healthcare utilization patterns, analyzing data to identify health trends, disparities, and areas for interventions. Collaboration and interdisciplinary approach, working collaboratively with professionals from diverse fields such as public health, medicine, social worker, economics, policy, to address complex health issues. Engaging in interdisciplinary research and partnership to advance knowledge and evidence-based practices in population health. Health promotion and diverse prevention, promoting healthy behaviors and lifestyle through education, community programs, and policy initiatives, developing strategies for disease prevention, early detection, and management to reduce the burden of chronic diseases and improve population health outcomes. Education of health systems and policies, assessing the impact of healthcare delivery system, policies, and interventions on population health outcomes and healthcare quality, recommending improvement in healthcare delivery, resource allocation, and access to services based on evaluation findings. Emergency preparedness and response, planning and coordinating responses to public health emergencies, natural disasters, or disease outbreaks to minimize their impact on population health, implementing emergency preparedness strategies and communicating plans to ensure effective response and recovery. ethics and advocacy, upholding ethical standards in research, data collection, and health intervention to protect the right and well-being of population, advocating for social justice, health equity, and the right of marginalized or underserved population. In summary, population health professionals play an important role in improving the overall health and well-being of communities by focusing on prevention, health promotion, policy development, and community engagements. ايه السكيلز والكompetences في epidemiology, understanding the distribution and determinants of health-related states or events in population, biostatistics, applying statistical methods to analyze health data and interpret research findings, health promotion and education, developing strategies to promote healthy behaviors and prevent disease in population, policy analysis, understanding healthcare policy framework and their impact on population health outcome, communication, effectively communicating health information to diverse audience, including policymakers, healthcare providers, and community members. Collaboration and interdisciplinary approach of population health professionals. This is an important aspect of the work of population health professionals. These professionals engage with diverse stakeholders and disciplines to address complex health challenges and promote holistic approach to improving population health. في عندنا من ال collaboration and interdisciplinary approach working with professionals from various disciplines such as medicine, public health, social work, and economic to address complex health issues. We collaborating with community organization, advocacy group, and governmental agencies to implement population health initiatives. Here is a deeper look at how collaboration and interdisciplinary approach are implemented through engagement with stakeholders, community organization, collaborating with local community group, nonprofit, and advocacy organization to understand community needs, build trust, and implement targeted health prevention. Healthcare providers, partnering with clinicians, nurses, and allied healthcare professionals to integrate preventive care strategies into clinical practice and coordinate patient care across different settings. Government agencies, working with local, state, and federal health department to align policies, share data, and advocate for population health initiatives. We academic institution collaborating with researchers, educators, and students to conduct studies, evaluate programs, and advance knowledge in population health. كمان interdisciplinary teams, public health professionals working alongside epidemiologists, biostatisticians, health educators, and environmental health specialists to analyze data, design interventions, and assess health risks. من خلال social workers addressing social determinant of health such as housing, employment, assess the access to social service to improve the health outcomes and equity. Economists to analyze the economic impact of health interventions and policies, and advocating for resource allocation to support population health initiatives. كمان من خلال policy makers, collaborating with policymakers to develop and implement evidence-based policies that promote health equity, improve healthcare access, and address population health disparities. من ال benefit of interdisciplinary collaboration, a comprehensive solution integrating diverse perspective and expertise lead to more comprehensive strategies that address the multi-phase determinant of health. Innovation, encouraging innovation through cross-disciplinary research, technology, integration, and creating problem-solving approach. Efficiency, streamlining efforts and resources by pooling knowledge and skills from various disciplines to achieve common population health goals. Capacity building, fostering professional development and learning opportunities across disciplines, enhancing the effectiveness of intervention and programs. من example of interdisciplinary project في community health need assessment, collaboratively conducting assessment to identify health priorities and develop tailored interventions. في health equity initiatives, integrating social determinant of health into healthcare delivery and policy development to reduce disparities. Research partnership, conducting joint research studies on population health trends, intervention, and outcome across disciplines. هنتكلم عن ال use of machine learning by population health professionals. Population health professionals increasingly utilize machine learning to enhance their ability to understand the health trends, to predict the outcomes, and improve intervention at the population levels. The key ways in which machine learning is being applied في population health من خلال predictive analytics. Predictive analytics provides valuable tools for population health professionals, enabling them to make data-driven decisions and improve public health outcomes. من applications of predictive analytics for population health professionals in disease surveillance and outcome and outbreak prediction. في epidemiological monitoring زي ما بيعمل tracking and predict the spread of infectious diseases to implement timely public health interventions. وفي outbreak detection زي ما بيعمل identify the potential outbreaks early by analyzing the patterns in data from hospitals, clinics, and public health records. في risk assessment and management زي chronic disease risk prediction بيتعمل identification للindividuals at risks for chronic diseases زي diabetes, hypertension, heart disease to implement preventive measures. وفي mental health risk assessment use data to predict and address mental health issues such as depression and anxiety in a specific population. Personalized intervention for targeted public health campaigns. We design and implement targeted health promotion and disease prevention campaigns based on population-specific data. وفي patient engagement كمان use predictive models to identify patients who are less likely to adhere to treatment plans and develop personalized intervention to improve compliance. في healthcare utilization and cost management. في cost prediction forecast healthcare costs for different population segments and develop strategies to manage and reduce expenditure. في utilization pattern we analyze the healthcare utilization patterns to identify inefficiencies and areas for improvement in service delivery. في population health management, integrated care models. Develop and implement integrated care models that use predictive analytics to coordinate care across different providers and settings. في health equity analysis, we identify and address disparities in healthcare access and outcomes among different population groups. في public health policy and planning, policy impact evaluation uses predictive models to assess the potential impact of public health policies and intervention before implementation. وفي health trend analysis, we monitor and predict the long-term health trends to inform strategic planning and policy development. في preventive health measures, vaccination campaigns predict the optimal times and location for vaccination campaigns based on disease prevalence and population demographics. في screening programs, we identify populations that would benefit most from screening programs for early detection and disease such as cancers. في behavioral health interventions, substance abuse preventions, we predict the patterns of substance abuse and develop targeted prevention and treatment programs. في lifestyle modification programs, we identify individuals at risk due to lifestyle factors and develop programs to encourage healthier behaviors. يبقى في predictive analytic application للhealth for population health professionals. By harnessing the power of predictive analytics, population health professionals can enhance their ability to anticipate health challenges, allocate resources efficiently, and implement effective intervention, ultimately leading to improved public health outcomes and reduced healthcare costs. يبقى كده احنا اتكلمنا عن البريدكتيف اناليتكس او اليوز للماشين ليرنينج في البوبوليشن هيلث بروفيشنالز. البريدكتيف اناليتيك تاني يوز في الهيلث كير ريسورس allocation, optimizing the allocation of healthcare resources such as hospital beds, medical staff, equipment based on predictive models of patient demand and resource utilization patterns. هنتكلم عن some specific applications for population health professionals زي hospitals and ICU capacity management, predicting patient admission. بيستخدم historical data and predictive models to forecast hospital admissions, enabling better planning and utilization of hospital and ICU beds. كمان surge capacity planning, anticipate the surge in patient volume such as during flu seasons or pandemics to ensure adequate staffing and bed availability. في emergency department optimization, في emergency department forecasting predict emergency department visits volumes to manage staffing level and to reduce wait time and improve patient flow. كمان في triage and resource allocation, use the predictive models to prioritize patient based on the severity of their condition, ensuring that critical cases receive immediate attention. في staffing and workforce management, optimal staffing scheduling, we forecast the patient demand to optimize the staff schedules, ensuring adequate coverage during peak time and reducing overtime costs. في skill mix planning, we allocate healthcare professionals with the right skills to areas where they are needed most, enhancing the quality of care. في supply chain and inventory management predicting supply needs forecast demand for medical supplies في medication and equipment to maintain optimal inventory levels and prevent shortage. في efficiency distribution optimize the distribution of supplies across healthcare facilities based on predicted needs and usage pattern. في resource allocation في primary care appointment scheduling predict patient non-shows and cancellation to optimize appointment scheduling and reduce wasted time slot. في chronic disease management allocate resources for managing chronic diseases such as diabetes and hypertension by identifying high-risk patients who require more intensive monitoring and intervention. في vaccination and preventive care programs targeted vaccination campaigns preventive في targeted vaccination campaign زي ما بيستخدم demographics and epidemiological data to identify population and high risk for infectious diseases and allocate vaccines accordingly. وفي preventive screening زي ما بيعمل prediction which population are most likely to benefit from preventive screening and allocate resources to maximize the impact of these programs. كمان في telehealth والremote monitoring. في telehealth resource allocation predict demand for telehealth services to ensure sufficient availability of telehealth providers and technology infrastructure. For remote patient monitoring, identify the patient who would benefit from remote monitoring and allocated devices and support services accordingly. في emergency preparedness and disaster response. Disaster response planning. Use predictive models to anticipate the impact of natural disasters or public health emergencies on healthcare demand and allocate resources for timely response. Evacuation and resource deployment. Plan for the evacuation and redistribution of healthcare resources in affected area to ensure the continuity of care. We feel health equity and access, addressing health disparities, identify underserved population and allocated resources to improve access to care, address the social determinant of health and reduce health disparities. في community health initiatives, allocate resources for community health programs based on the need and health risk of specific population. وفي cost management and efficiency, في cost benefit analysis, use predictive models to analyze the cost effectiveness of different resource allocation strategies and prioritize those that offer the best outcomes for the investment. Reducing waste, identifying areas of inefficiencies and waste for resource utilization and implement strategies to optimize resources use and reduce cost. By applying predictive analytics to healthcare resource allocation, population health professionals can enhance their ability to deliver timely, efficient, and equitable care, ultimately improving health outcomes and maximizing the value of healthcare investments. يبقى uses of machine learning by population health professionals. اتكلمنا على predictive analytic، عن health care resource allocation، هنتكلم عن personalized medicine. personalized medicine application for population health professionals, developing personalized treatment plans and interventions based on individual patient data زي genetic information زي medical history to improve health outcomes and treatment efficacy. Here are some key applications زي genomic risk assessment في genetic screening. Use genetic data to identify individuals at high risk for specific diseases, allowing for early intervention and tailored preventive measures. في family history analysis, analyze family medical histories to predict genetic predisposition to certain condition and guide the screening and prevention strategies. في targeted treatment في الفارماكوجينومكس بيتيلر الدراج prescriptions based on individual genetic profiles to maximize the efficacy and minimize the adverse reactions. في precision oncology use molecular profiling of tumors to guide personalized cancer treatments, including targeted therapies and immunotherapies. في chronic disease management في customized care plan. Develop individualized care plan for chronic conditions like diabetes, cardiovascular diseases, asthma, based on genetic lifestyle clinical data. في monitoring and adjustment, continuously monitor patient data to adjust the treatment plans in real time, improving disease management and outcomes. Predictive analytics for disease prevention. Lifestyle interventions. Identify individuals who would benefit most from lifestyle modifications such as diet, exercise, based on their genetic and metabolic profiles. كمان behavioral health use predictive models to assess risk factors for mental health conditions and provide personalized interventions and support. في population stratification, subgroup identification, segment population بيقسم population into subgroups based on genetic and phenotypic characteristic to design more effective public health interventions. بيعمل tailored public health campaigns, develop targeted health promotion and disease prevention campaigns that address the specific needs of different population subgroups. Nutrigenomic, personalized nutrition بيتailer dietary recommendation based on individual genetic profiles to prevent nutrition-related diseases and optimize health. Metabolic health use genetic and metabolic data to create personalized plans to managing conditions like obesity and metabolic syndrome. Reproductive health, precision planning, كمان في infectious disease management, vaccine response prediction, predict individual responses to vaccine based on genetic and immunological data to optimize the vaccination strategies, antimicrobial stewardship, use genetic data to guide the use of antibiotic and other antimicrobial agent, reducing the risk of resistance, health monitoring and wearable, personal health devices, integrate data from wearable devices and sensors to monitor individual health metrics and provide personalized feedback and intervention. For real-time analytics, use real-time health data to predict and prevent adverse health events such as heart attack or stroke. في ال behavioral and environmental factor في ال comprehensive risk profiles combine the genetic, environmental, and lifestyle data to create comprehensive risk profile and personalized prevention strategies. في ال environmental exposure assessment assess the individual exposure to environmental risk زي ال pollution, ال allergens, and provide personalized recommendation to mitigate this risk. وفي ال patient engagement and empowerment ال educational tool provide patient with personalized information and educational resources to help them understand their health risk and make informed decision, shared decision making, engage patient with shared decision making processes using personalized data to guide discussions about treatment options and health behaviors. By using personalized medicine, population health professional can enhance the precision and effectiveness of healthcare interventions, leading to better health outcomes, improved patient satisfaction, and more efficient use of healthcare resources. اتكلمنا في ال use of machine learning عن في population health by population health professionals عن ال predictive analytics عن ال healthcare resource allocation ال personalized medicine. هنتكلم على ال chronic disease management, monitoring and managing chronic condition through remote patient monitoring and predictive modeling to detect early signs of deterioration and intervene proactively. أول application هنتكلم عن ال risk stratification and identification. Predictive analytics use data analytics to identify individuals at high risk of developing chronic diseases like diabetes, heart disease, COPD, وال screening programs implement community-wide screening initiatives to detect early signs of chronic diseases and intervene promptly. في ال care coordination, multidisciplinary teams form teams that include primary care, physician, specialists, nurses, dietitians, and other healthcare professionals to provide comprehensive care. Integrated care model utilize the integrated care models to ensure seamless coordination between different levels of care and reduce care fragmentation. Remote monitoring and telehealth services offer telehealth consultations to provide convenient access to healthcare service, especially for patients in remote or underserved area. Remote patient monitoring use devices to monitor patient vital signs and health metrics in real time, allowing for early detection of complication and timely intervention. في ال chronic disease self-management programs, patient education provide educational resources and workshop to help patients understand their condition and manage their health effectively. We support groups, they facilitate support groups where patients can share experiences and receive peer support. By utilizing this chronic disease management application, population health professionals can improve the quality of care, enhance patient outcomes, and reduce the overall burden of chronic diseases on the healthcare system. اتكلمنا عن ال predictive analytic, ال healthcare resource allocation وال personalized medicine وال chronic disease management. هنتكلم عن ال natural language processing في استخدام الماشين ليرنينج في ال population by the population health professionals. أول application في الماشين ليرنينج processing اللي بيعمل analysis زي ما قلنا لل unstructured text data from clinical notes والسوشيال media والpatient feedback to extract the valuable insight for improving the population health strategies and patient care. أول application في استخدام electronic health record analysis عن طريق الكلينيكال دوكيومنتيشن. يقدر يعمل natural language processing automate extraction of relevant information from unstructured clinical notes, improving the completeness and accuracy of electronic health records. كمان في patient summarization generate concise patient summaries from detailed clinical notes to provide quick insight into a patient's health status. في population health analytics, في trend analysis, analyze a large volume of text data from various sources to identify health trends and emerging public health issues. في sentiment analysis, assess the public sentiment from social media, في forum and surveys to gauge community attitude toward health interventions and policies. في risk stratification, predictive modeling, use the natural language processing to extract irrelevant risk factors from clinical notes and integrate them into predictive models for identifying health risk patient, high risk patients. في health risk assessment, we enhance risk assessment by including information from unstructured data sources such as patient histories and doctor notes. في clinical decision support, في alert and reminders, automatically generate alerts and reminders for healthcare providers based on information extract from clinical notes. Decision aids, provided decision support tools that use natural language processing to interpret clinical guidelines and patient data to recommend the evidence-based interventions. في patient communication, chat bot and virtual assistant, implement AI-driven chatbot to answer patient queries, وإنه يعمل scheduling للappointments and provide health information. في patient education, يستخدم natural language processing to tailor educational materials to the specific needs and literacy levels of patients. في quality improvement, clinical quality measures, extract and analyze data related to clinical quality measures from electronic health record to monitor and improve the quality of care. يقدر يعمل error detection, identify and flag inconsistencies or errors in clinical documentation that may affect the patient care. في public health surveillance, في disease outbreak detection, يقدر يعمل monitor للسوشيال ميدياز والنيوز articles والother text sources to detect early signs of disease outbreaks and other public health threats. في health behavior monitoring, بيتراك changes في health behaviors and trend within a population through analysis of online forum and health-related content. في research knowledge discovery, في literature review, automate the process of reviewing and summarizing a large volume of specific literature to stay current with the latest research. في clinical trials matching, بيستخدم natural language processing to match patients with suitable clinical trials based on information extracted from their medical records. في social determinant of health, social determinant of health extraction, extract information about patients' social, economic, and environmental conditions from clinical notes to better understand their impact on health. في community need assessment, analyze text data from community surveys and report to identify and address social determinant of health related health disparities. patient adherence and engagement adherence monitoring. Use natural language processing to analyze patient communication and identify potential barriers to medication adherence. وفي engagement tracking, monitor patient engagement with healthcare service and intervention through the analysis of patient-provider communication. في health policy analysis, policy impact evaluation, analyze public comments والpolicy documents to assess the impact of health policies and regulations. Stakeholder analysis, use natural language processing to identify and understand the perspectives of various stakeholders on health policy issues. في behavioral health application, في mental health assessment, analyze the clinical notes patient communications to identify signs of mental health conditions such as depression, anxiety. وفي substance abuse monitoring, monitor and analyze the patterns of substance use and abuse through the analysis of text data from various sources. By using natural language processing, population health professionals can gain deeper insight from unstructured data, enhance patient care, and improve overall public health outcomes. من uses of machine learning by population health professionals, predictive analytics, healthcare resource allocation, personalized medicine, chronic disease management, natural language processing. وهنتكلم عن behavioral health and wellness. Using machine learning to analyze behavioral data زي lifestyle choices, activity levels, to promote wellness initiatives and preventive health behaviors within populations. من applications بتاعتها زي screening and early intervention. في mental health screening. Implement routine screening for mental health conditions زي depression, anxiety في primary care setting. في substance use assessments زي use standardized tools to screen for substance use disorders and provide early intervention. في integrated care models زي behavioral health integration, integrate mental health services into primary care practices to provide comprehensive care and reduce stigma. في collaborative care models, we develop multidisciplinary teams that include the primary care providers with mental health specialists with social workers to manage complex cases. في telehealth remote services زي telepsychiatry, we offer psychiatric consultation and therapy sessions via telehealth to increase access, especially in underserved area. With remote monitoring, use digital tools and application to monitor patients' mental health and substance use behaviors, providing timely support and intervention. For patient engagement and education, a digital health platform, we develop application and online platform to provide educational resources, self-help tools, and support communities for mental health and wellness. في personalized wellness plans, we create individualized wellness plans that include strategies for managing stress, improving sleep, for fostering healthy relationship. في community-based program, peer support groups, facilitate peer-led support groups for mental health and substance use recovery to provide mutual support and reduce isolation. في community outreach, conduct outreach program to educate communities about mental health و reduce stigma and promote available resources. في crisis interventions في عندنا crisis hotlines provide 24/7 access to crisis hotlines for immediate support and intervention. في mobile crisis units deploy mobile crisis response teams to provide on-site support for individuals experiencing a mental health crisis. Preventive programs, stress management workshop offer workshops and programs focused on stress reduction techniques زي mindfulness, meditation, yoga. Substance use prevention implement school and community-based programs to educate youth and adults about the risk of substance use and strategies for prevention. Workplace wellness employee assistance program provide employee assistance programs that offer counseling with stress management resources and support for employee dealing with mental health or substance use issues. في wellness initiatives promote wellness initiatives in the workplace such as mental health days, exercise programs, and access to healthy food options. Data-driven decision making, behavioral health analytics use data analytics to identify trends, measure program effectiveness, and inform policy decision related to behavioral health and wellness. Population health dashboard develop dashboards to monitor key behavioral health indicators and track progress toward health goal. في health policy advocacy في policy development advocate for policy that support mental health parity, access to care, and funding for behavioral health programs. Legislative engagement work with legislator to promote laws that protect the rights and well-being of individuals with mental health and substance use disorders. School-based program mental health education integrate mental health education into school curriculum to teach students about emotional well-being and coping strategies. School counseling service enhance school counseling service to provide support for students facing behavioral health challenges. Cultural competency, cultural sensitive care, train healthcare providers in cultural competency to better understand and address the unique behavioral health needs of diverse population, where community partnership collaborate with community organization to develop culturally appropriate behavioral health program and intervention. Technology and innovation, AI and chatbot use AI-powered chatbot to provide immediate support and resource for individuals seeking help for mental health or substance use issues. Wearable and health application use wearable and health application to track physical activity, sleep patterns, and other factors that influence mental well-being. By implementing these behavioral health and wellness application, population health professional can enhance the quality of care, improve access to service, and promote overall well-being within the community they serve. يبقى كده اتكلمنا عن الuses of machine learning by population health professionals، اتكلمنا عن predictive analytics، عن health care resource allocation، عن personalized medicine، عن chronic disease management، عن natural language processing، وعن behavioral health and wellness. في عند حضراتكم أي سؤال في السيشن ديت؟ أستأذنكم لو في أي حاجة مش واضحة ابعتولي في الكومنتس. Thank you very much. أستأذنكم ناخد بريك 20 دقيقة ونرجع تاني. Thank you very much. شكرا جزيلا. مساء الخير. هنكمل مع بعض. البروجرام بتاع النهاردة بيتكلم عن AI powered population health. اتكلمنا في السيشنز بتاعتنا اللي قبل البريك عن الرول of AI in population health، الرول of big data in population health، وازاي الماشين ليرنينج فاندامنتالز بنستخدمها في من البوبوليشن هيلث بروفيشنالز. هنتكلم دلوقتي عن ال AI powered risk stratification and intervention design. هنبدأ الأول نتكلم عن الريسك stratification in population health. In population health, risk stratification involve categorization and categorizing individuals or groups within a population based on their likelihood of certain health outcomes. This process is very important for targeting interventions and resource effectively. Here is how it typically works. Through data collection, gathering relevant information from various sources, such as electronic health records, health survey, claim data, socioeconomic information, and environmental factors. Feature selection, identifying key variables or features that are predictive of health outcomes. These can include demographic information, age, gender, clinical data زي ال chronic condition, ال medication usage, ال behavioral factors زي ال smoking, ال exercise habit, and social determinant of health زي ال income level وال education. Risk assessment, using statistical models to analyze the collected data and predict the likelihood of individuals developing certain health condition or experiencing health events زي hospitalization, emergency visits. stratification اللي هو grouping للindividuals into risk categories based on their predicted risk levels. These categories often include low risk, moderate risk, high risk, and sometimes additional stratification based on specific conditions or needs. Intervention planning, tailoring interventions and healthcare strategies based on the identified risk categories. For example, high-risk individuals may receive targeted interventions such as care management programs, preventive screening, or lifestyle intervention to mitigate the risks. Monitoring and evaluation, continuously monitoring outcomes and adjusting interventions as needed based on new data and feedback loops. Population health management, implementing population-level strategies to improve overall health outcomes and reduce disparities by addressing the needs of different risk groups efficiently. By applying risk stratification in population health management, healthcare organizations and policymakers can prioritize resources, improve care coordination, and ultimately enhance the health and well-being of communities. ايه هي بقى الانترفنشن ديزاينز in population health؟ Intervention design in population health refers to the process of planning and implementing strategies aimed at improving the health outcomes of a specific population or community. These interventions can range from preventive measures to manage of chronic condition. Here is how intervention design typically unfolds. عن طريق need assessment, conducting a thorough assessment to understand the health needs, risks, and determinant affecting the population. These involve analyzing data on demographics, health behaviors, existing health conditions, socioeconomic factors, and environmental influences. Goal setting, establishing clear goals and objectives for the intervention based on identified needs and priorities. Goals should be specific, measurable, achievable, relevant, and time-bound. Evidence-based strategies, selecting evidence-based strategies and interventions that have been shown to be effective in similar population or setting. These may include preventive interventions, promoting healthy behaviors زي physical activity, nutrition, through vaccination and screening programs, clinical management, improving access to and quality of healthcare services, chronic disease management programs, and adherence support. Implementation plan, developing a detailed plan outlining the implementation steps, roles, and responsibilities of stakeholders, timelines, and budget considerations. Monitoring and evaluation, establishing metric and indicators to assess the effectiveness of the intervention. Continuous monitoring allows for adjustment to be made in real time, ensuring the intervention stays on track toward achieving its goals. Sustainability and scalability, designing interventions with sustainability in mind, considering factors such as funding sources, community buy-in, and integration into existing healthcare systems. Scalability involves assessing the potential for replicating and expanding successful interventions to serve larger population. Ethical consideration, ensuring interventions are implemented ethically, respecting autonomy, confidentiality, and cultural consideration of the population being served. Effective intervention design in population health requires collaboration among healthcare providers, community organizations, policymakers, and individuals themselves to address health disparities, promote health equity, and improve overall well-being. هنتكلم عن ال AI powered risk stratification applications and examples in population health. AI powered risk stratification in population health has numerous applications aimed at improving health outcomes across communities and large groups of individuals. Here are some key applications and examples. في ال chronic disease management, diabetes management, AI algorithm can predict which individuals are at high risk of developing complications related to diabetes based on factors زي blood glucose level, medication adherence, lifestyle choices. This allows healthcare providers to tailor interventions and monitor high-risk patients more closely. كمان ممكن to predict which patients are at high risk of uncontrolled hypertension and complications, enabling personalized treatment plans and intervention to manage blood pressure effectively. كمان في example من الابليكيشن في preventive health care زي مثلا using AI to analyze the patient data and predict the likelihood of developing certain cancers based on genetic predispositions, lifestyle factors, and screening histories. These facilitate targeted screening programs and early detection efforts. كمان ممكن زي ما نعمل predicting للvaccine uptake rates and identifying the population at higher risk of vaccine preventable diseases, guiding public health campaigns and outreach efforts. من الابليكيشنز للاي اي باورد ريسك stratification الهيلث ريسك اسسمنت. مثلا الاي اي مودلز can assess cardiovascular risk by analyzing a combination of clinical data زي الكوليسترول ليفل، البلاد blood pressures، اللايف ستايل فاكتورز زي السموكينج والاكسرسايز habits. These help prioritize the preventive measures and lifestyle interventions. كمان ممكن زي لما يجي يعمل predicting للindividuals at risk of mental health disorders زي الdepressions, anxiety based on behavioral patterns, social interactions, and demographic factors. These enable targeted mental health interventions and support services. في الهيلث من الابليكيشن الهيلث كير ريسورس الوكيشن، زي مثلا ما الاي اي يعمل predicting which population are likely to use emergency services frequently based on historical data and health conditions. This helps allocate resources more efficiently and implement preventive care initiatives. كمان ال AI algorithm يقدر يعمل identification للpatient at high risk of hospital readmissions after discharge, allowing for targeted interventions such as transitional care programs and follow-up appointments. في public health surveillance مثلا زي using ال AI to analyze the health data and environmental factors to predict the outbreaks of infectious diseases such as influenza, COVID-19. These facilitate early detection and rapid response strategies. كمان زي ما يقدر ال AI predict the health risk associated with environmental factors زي ال air pollution, ال water quality, to inform public health policies and interventions aimed at reducing environmental health hazards. في ال health disparities reduction analyzing the social determinants زي ال income level, ال education, access to health care, to identify vulnerable population at risks of poor health outcomes. These inform targeted interventions and policies to address health disparities and improve equity. These applications demonstrate how AI-powered risk stratification in population health can enhance decision-making, resource allocation, and preventive healthcare strategies to improve overall health and well-being within communities. عندنا كمان ال AI-powered intervention designs applications and example في ال healthcare uses AI to develop and implement targeted strategies aimed at improving the health outcome across communities. من ال applications والexamples ديت ال personalized health interventions زي مثلا ال AI algorithm can personalize the treatment plans for individuals with chronic conditions زي الديابيتس, الهايبرتنشن based on their health data, lifestyle factors والtreatment responses. These include optimizing the medication regimen, recommending a lifestyle changes, and scheduling a follow-up care. كمان زي ال early intervention program, predictive analytics for disease prevention using AI to identify individuals at high risk of developing certain diseases زي cardiovascular diseases, diabetes based on their health history, الجينيتك predisposition، lifestyle factors. Interventions can then focus on preventive measures such as screening, lifestyle counseling, vaccination campaigns. behavioral modification and adherence. زي ما ال AI can predict the adherence patterns among the patient with chronic condition by analyzing factors such as prescription refill rate, patient reported outcomes, socioeconomic indicators. Intervention may include personalized reminders, educational content, and incentives to improve الادherence للميديكيشن. كمان using ال AI to analyze the behavioral patterns and social determinants of health زي ال physical activity levels, dietary habits, to design a targeted intervention aimed at promoting healthier behaviors. This could involve personalized coaching, digital health tools, and community-based programs. الكوميونتي هيلث بروجرامز زي ما ال AI يقدر يanalyze the population level data to identify groups at higher risk of specific health issues زي ال smoking cessation, ال maternal health. Intervention may include tailored educational campaigns, ال outreach efforts, and community engagement strategies. كمان using ال AI to assess the community needs and preferences to design the interventions that address the local health changes. This could involve partnering with community organization, using digital platforms for health education and facilitating access to healthcare services. في ال emergency response and disaster management زي ما ال AI powered algorithm can analyze real-time health data زي ال symptoms reported via telemedicine زي ال epidemiological trends to detect the outbreak early and facilitate prompt response measures. These include deploying resources, coordinating healthcare teams, and communicating public health advisory. كمان يقدر يعمل predictive analytics. كمان can inform resource allocation during emergencies or natural disasters by forecasting healthcare demands, identifying vulnerable population, and ensuring timely delivery of medical supplies and personnel. وفي policy development and evaluation ال AI can analyze large-scale health data to evaluate the effectiveness of public health policies and interventions. These include assessing health outcomes, cost effectiveness, and equity implication to inform evidence-based policymaker. كمان utilizing ال AI to monitor ال healthcare quality metrics, identifying areas for improvement, and ensure compliance with regulatory standards. These include analyzing clinical outcomes, patient satisfaction scores, and operational efficiencies to enhance healthcare delivery. These examples illustrate how AI-powered interventions design in population health can optimize healthcare delivery and promote health equity and empower individuals and communities to achieve better health outcomes. يبقى ان ال AI powered risk stratification and intervention design for population health أول حاجة هنتكلم فيها عن ال data collection and integration. فمن ال AI application for data collection and integration for risk stratification هنتكلم عن ال automated data extraction. ال AI can automate the extraction of structured and unstructured data from various sources زي ال electronic health records, imaging reports and patient notes. Natural language processing technique can parse text to extract relevant information. Integration of heterogeneous data. AI algorithm can integrate diverse data sets, including clinical data, genomic data, social determinant of health data, wearable device data, and environmental factors. These integrations ensure a comprehensive view of an individual's health status and risk factors. Real-time data streaming. AI-powered system can handle real-time data streams from wearable devices and Internet of Things control. AI can assist in data quality control by identifying inconsistencies, errors, or missing values in data sets, ensuring reliable input for subsequent analysis. في data integration, unified data representation. AI technique like machine learning can harmonize data from different sources into a unified representation, overcoming challenges posed by varying formats and standards. Feature engineering. The AI algorithm can automatically generate new features or transform existing ones to enhance predictive models. This process is very important for identifying relevant predictors of health outcomes. Semantic interoperability. AI can facilitate semantic interoperability by mapping disparate terminologies and ontologies used across different healthcare systems, improving data exchange and integration. The benefit of AI في data collection and integration إنه ال AI بيautomate tedious tasks like data extraction and quality control, reducing the manual effort and time spent on data preprocessing وده كده اسمه efficiency. كمان accuracy. ال AI algorithm improve the accuracy of data integration and analysis, enhancing the reliability of risk prediction and intervention recommendation. Scalability. ال AI system can scale to handle large volume of data efficiently, accommodating growing data sets and population health management needs. In conclusion, AI application in data collection and integration are pivotal for advancing risk stratification and intervention design in population health. By harnessing AI's capabilities, healthcare providers can derive actionable insight from complex data ecosystems, leading to more effective and personalized healthcare delivery. يبقى ال AI powered stratification and intervention design for population health. اتكلمنا عن data collection and integration. هنتكلم عن ال feature selection and engineering. وإيه هي ال AI application في for feature selection and engineering for risk stratification for population health. ال feature selection and engineering. عندنا ال statistical methods. ال AI algorithm can employ statistical tests زي ال chi-square للcategorical feature، زي ال ANOVA للنumerical feature to select the most relevant variables. في ال filter methods زي اللي هي بتاعت لما نيجي نعمل correlation analysis. ال AI can identify and filter out highly correlated feature, reducing redundancy and improving the model الموديل interpretability. كمان في الرابر methods ال AI can remove feature and evaluate models model performance وselecting الفيتشر that optimize the predictive accuracy. كمان ال AI algorithm sequentially add or remove feature based on model performance metrics وريفايننج الفيتشر sets. الفيتشر engineering الderived feature زي مثلا ال AI can transform raw data to meet assumption of predictive models and improve performance. ال AI algorithm can create new features that represent interactions between existing variables, capturing complex relationship in data. ال temporal feature اللي هي time series analysis. ال AI technique can extract temporal patterns from health data, enhancing predictive models for longitudinal risk assessment. في الدومين specific feature زي ال healthcare ontology. ال AI can leverage domain specific ontologies زي ال ICD-10 to extract clinically relevant features, ensuring alignment with healthcare standards and terminology. The benefit of AI in feature selection and engineering إنه بيعمل enhanced للpredictive accuracy. ال AI algorithm improves the selection of relevant features, reducing the noise and improving the model performance in predicting health outcomes. ال interpretability AI-driven feature selection methods provide insight into which variables influence health outcomes, facilitating clinical decision-making and intervention planning. والscalability ال AI techniques scale efficiently to handle large-scale data sets, accommodating diverse sources of health data for comprehensive risk assessment and intervention design. يبقى ال AI powered risk stratifications and intervention design for population health اتكلمنا فيها عن ال data collection and integration، عن ال feature selection and engineering، هنتكلم عن ال model development. سواء ال algorithm selection إن إحنا نعمل choosing لل appropriate AI algorithm based on the problem complexity and data characteristics. من الموديل ال AI application للموديل development للريسك stratification إيه الموديل أول حاجة الالجوريزم selection. ال AI model are applied to predict health outcome based on labeled training data. Ensemble methods. The AI can combine predictions from diverse models to improve the overall accuracy risk prediction. A deep learning approach. Neural networks. The AI-driven neural network capture a complex relationship in health data for more accurate prediction. With time series analysis اللي هي temporal model ال AI algorithm بيanalyze sequential health data زي ال patient histories to predict future health outcomes and support longitudinal risk assessment. The benefit of AI in model development ال precision and accuracy. ال AI algorithm improve the accuracy of risk prediction by analyzing the complex interaction between the multiple variables, providing more precise risk assessment compared to traditional statistical approach. The personalization, the AI-driven models enable personalized healthcare intervention tailored to individual risk profile, enhancing the patient engagement and adherence to treatment plans. والscalability, ال AI techniques scale efficiently to handle large scale population health data, accommodating diverse sources of volume of data for comprehensive risk assessment and intervention design. In conclusion, ال AI application في model development is very important in advancing the risk stratification and intervention design في population health. احنا كده اتكلمنا عن data collection and integration، عن ال feature selection and engineering، عن ال model development، عن ال risk stratification. هنتكلم عن الريسك stratification، ال AI application في الريسك stratification intervention. أول حاجة ال data sources. AI integrate data from various sources including the electronic health records, the genomic data, the socio-economic factors, the environmental data, the patient generated data من ال wearable devices. ال AI can handle real-time data stream from Internet of Things devices and sensor, providing continuous monitoring of health metrics and behavior. يبقى ال data collection and integration، اتكلمنا عن ال data sources، عن ال real time data، ان ال AI can handle ال real time data from Internet of Things devices، ويبروفايد ال continuous monitoring لل health metrics and behaviors. ال feature selection and engineering، ال automated feature selection، ال AI algorithm select relevant feature from heterogeneous dataset identifying the key predictors of health outcomes. ال feature engineering، ال AI create a new feature or transform the existing one to improve the predictive accuracy, capturing complex relationship in data. وفي الموديل ديفلوبمنت ال AI employs algorithm to predict the health risk based on label data. Clustering algorithm can group individuals with similar health risk based on patterns in their data. والrisk prediction and stratification, individual risk assessment. ال AI predict the probability of individuals developing specific diseases or conditions based on their health profiles and historical data. The population segmentation، ال AI categories population into categorize. ال AI يقدر يقسم ال population ل risk groups زي low, medium, high risk based on predictive models facilitating targeted interventions and resource allocation. من ال benefit of AI في risk stratification ال early detection. ال AI enable ال early detection of health risk, allowing the timely intervention to prevent disease progression and improve health outcomes. في precision ال AI support personalized medicine by tailoring treatments and intervention to individuals' risk profile, enhancing patient outcomes and reducing the healthcare costs. في efficiency ال AI automate complex analysis and analyze and make decisions processes, enabling healthcare providers to focus resources on high-risk population more efficiently. يبقى in conclusion ال AI application في risk stratification empower the healthcare system to use data-driven insight for proactive and personalized care, ultimately improving the population health outcomes and enhancing the efficiency of healthcare delivery. اتكلمنا عن ال data collection and integration، عن الفيتشر سelection and engineering، عن الموديل ديفلوبمنت، ريسك stratification، هنتكلم عن الانترفنشن ديزاين اند اوبتمايزيشن، يعني intervention strategies to develop targeted interventions زي personalized health recommendation، زي الميديكيشن adjustment، زي اللايف ستايل modification، ونعمل optimization عن طريق ان انا بستخدم ال AI to optimize intervention strategies based on predicted outcomes and real-time feedback. من ال AI application for intervention design and optimization في ال population health، ال personalized intervention design، ال predictive modeling، ال AI algorithm predict individual health outcomes and identify health risk individuals who would benefit most from intervention. و recommendation system، ال AI driven recommendation system suggests personalized intervention based on predictive analytics and individual health data. وال behavioral analysis، ال AI analyzes patient behavioral and preferences to design interventions that are more likely to be accepted and adherent to optimization of intervention strategies زي ال dynamic adjustment. ال AI continuously optimizes the intervention strategies based on real-time data and feedback, adapting to changing health conditions and responses. في resource allocation، ال AI optimizes resource allocation by prioritizing interventions for individuals at higher risk or those likely to benefit the most. ال cost effectiveness analysis، ال AI evaluate the cost effectiveness of interventions by predicting outcomes and comparing against costs, informing decision making. كمان في ال adaptive decision support system زي ال clinical decision support. ال AI provide real-time decision support to healthcare providers by recommending interventions based on the latest evidence and patient-specific data. وال alert system، ال AI alerts healthcare teams about the critical changes في ال patient health status or adherence to intervention plans, enabling timely adjustment. ال continuous learning and improvement، ال feedback loop. ال AI incorporate feedback from interventions to refine models and improve predictive accuracy and intervention effectiveness over time. ال machine learning models، ال AI uses ال machine learning models to learn from outcomes and optimize future intervention strategies. من ال benefit of AI in interventions design and optimization، ال personalization. ال AI enables tailored interventions based on individual health profiles, enhancing engagement and adherence. ال efficiency، ال AI automate and optimize intervention strategies, improving resource allocation and healthcare delivery efficiency. كمان improved the outcome. ال AI driven interventions lead to better health outcome by targeting intervention where they are most effective and needed. يبقى احنا اتكلمنا في ال AI powered risk stratification and intervention design for population health عن ال data collection and integration. اتكلمنا عن ال feature selection and engineering، ال model development، ال risk stratification، ال intervention design and optimization. هنتكلم عن ال evaluation and validation. عن طريق البرفورمانس ماتريكس measure the effectiveness of AI models and intervention using metrics زي الاكيورسي السنسيتيفيتي السبيسيفيسيتي الكلينيكال outcomes والفاليديشن ان انا اعمل validate للمودلز with prospective studies and adjust algorithm based on real world feedback. من ال AI application for evaluation and validation للrisk stratification and intervention design في population health performance metrics accuracy and precision. AI algorithm are evaluated based on their accuracy in predicting health outcomes and precision in identifying high-risk individuals or groups. sensitivity and specificity. الماتريكس زي السنسيتيفيتي اللي هي الترو بوزيتيف ريتس and specificity اللي هي الترو نيجاتيف ريت assess the algorithm ability to correctly identify the individuals at risk and those not at risk respectively. The area under the curve of the receiver operating characteristics curve measures the overall performance of risk prediction models, reflecting the trade-off between sensitivity and specificity. Calibration, AI models should be well calibrated, meaning predicted probabilities align closely with actual observed outcomes. في validation methods cross validation زي اللي هي التكنيك زي الكي فولد cross validation assess the model's performance by splitting the data into multiple subsets, training the model on several combination of subset and evaluating it on the remaining subset. أو hold out validation data is split into training and testing sets with the model trained on the training set and evaluated on the unseen testing set to assess the generalization performance. أو external validation إن AI models are validated using data from independent sources or external data set to assess their generalizability and across different population or settings. ethical طبعا consideration bias والfairness bias and fairness. AI algorithm should be evaluated for bias, ensuring fair treatment across diverse demographic groups and mitigating biases that could lead to disparities in healthcare outcomes. Privacy and confidentiality ensures that data handling practices adhere to regulatory requirements to protect patient privacy and confidentiality. Transparency and interpretability. The AI model should provide transparent results and explanation of predictions to healthcare providers and patients, enhancing trust and facilitating informed decision-making. For continuous improvement, feedback integration, incorporate feedback from healthcare providers and patients to refine AI models and improve predictive accuracy and intervention effectiveness over time. Adaptation to new data, AI system should be adaptive, continuously learning from new data and updating models to reflect changing health condition and dynamics. من benefit of AI في evaluating and evaluation and validation, evidence-based healthcare. AI enhances the evidence base for healthcare interventions by rigorously evaluating and validating predictive models and intervention strategies. كمان improved outcomes. Validated AI models lead to more effective interventions, ultimately improving the population health outcomes and optimization resource allocation. Cost effectiveness.
by identifying effective interventions early and optimizing resource allocation, AI contributes to reducing healthcare costs and improving efficiency. In conclusion, the AI application in evaluation and validation plays an important role in advancing risk stratification and intervention design in population health by ensuring the accuracy, reliability, and ethical soundness of predictive models and healthcare intervention. اتكلمنا عن الداتا collection and integration, الفيتشر selection, الانجينيرينج، الموديل ديفلوبمنت، الريسك ستراتيفيكيشن، الانترفنشن ديزاين اند اوبتمايزيشن، الايفالويشن اند فاليديشن. هنتكلم عن الامبلمنتيشن والديبلويمنت اللي هي الانتجريشن ويز هيلث كير سيستم، ديبلوي الاي اي موديل ويزين الهيلث كير ورك فلو زي الالكترونيك هيلث ريكورد انتجريشن والكلينيكال ديسيجن سبورت سيستم. من الابليكيشنز الاي اي ابليكيشن implementation and deployment for risk stratification and intervention design، الانفراستراكشر and data integration، الداتا infrastructure set up robust infrastructure capable of handling large volume of data from diverse sources زي الالكترونيك هيلث ريكورد، الويرابلز، السوشيو ايكونوميك داتا، والداتا integration. Use AI tools to integrate and pre-process heterogeneous data, ensuring consistency and quality for subsequent analysis. Model development and validation. Algorithm selection. Choose appropriate AI algorithm زي machine learning models, deep learning based on the complexity of the problem and data characteristics. Training and validation. Train models and historical data, validate them using rigorous methods زي cross validation, external validation, and ensure they meet performance metrics and regulatory standards. الكلينيكال انتجريشن اند ديسيجن سبورت، الكلينيكال ديسيجن سبورت سيستم integrate AI driven risk stratification models into clinical workflow and decision support system, providing actionable insight to healthcare providers at the point of care. والuser interface develop user friendly interfaces that present AI generated insight in a clear and interpretable manner for healthcare professionals. والethical and regulatory considerations زي data privacy, ensure compliance with regulations regarding data privacy and patient confidentiality throughout the implementation process. والbias mitigation address potential biases in AI algorithms to ensure fairness and equity in healthcare delivery, particularly in risk stratification across diverse patient population. With stakeholder engagement and training, healthcare provider training. Train healthcare providers on how to interpret AI-generated risk assessment and recommendations, integrating the AI tool into their clinical practice, patient engagement, educate patients on the benefits and implication of AI-driven intervention, ensuring their participation and adherence to personalized healthcare plan. Evaluation and continuous improvement. Performance monitoring continuously monitors the performance of AI model in real-world setting, collecting feedback from healthcare providers and patients to refine and improve algorithm. Iterative refinement, use feedback loop to update models based on new data and insight, ensuring continuous improvement in predictive accuracy and intervention effectiveness. من ال benefit of AI implementation precision and efficiency. AI enable precise risk stratification and personalized intervention design, optimizing resource allocation and healthcare delivery efficiently. We improve the patient outcome. AI-driven intervention lead to better health outcome by targeting interventions where they are most effective and needed. We cost effectiveness by identifying high-risk individuals early and optimizing interventions. AI contribute to reducing healthcare costs associated with preventable conditions and hospitalization. يبقى احنا اتكلمنا عن الداتا collection and integration, الفيتشر selection and engineering, الموديل development, الريسك stratification, الانترفنشن design and optimization, الايفالويشن and validation, الimplementation and deployment. هنتكلم عن الethical consideration من الابليكيشن بتاعت الethical consideration, الداتا privacy and confidentiality, patient consent, obtain informed consent for data collection, sharing and use in AI-driven models, data security, implement robust measures to protect sensitive health information from unauthorized access or breach. Anonymization ensures that data used for AI analysis is anonymized whenever possible to prevent identification of individuals. Bias and fairness, algorithmic bias, mitigate biases in AI algorithms that could lead to unfair treatment or disparities in healthcare outcomes across different demographic groups. Fair representation ensures that data sets used for training AI models are representative of diverse populations to avoid biased prediction. Transparency and explainability. Interpretability ensures that AI models provide transparent and interpretable results to healthcare providers and patients, explaining how predictions are made. Algorithm transparency. Disclose information about the algorithm used, including data sources, training methods, and potential limitation. Accountability and oversight. Accountability. Establish clear accountability for decisions made based on AI prediction, including the roles and responsibilities of healthcare providers and AI developers. Oversight. Implement governance framework and regulatory oversight to monitor the ethical use of AI in healthcare, ensuring compliance with ethical guidelines and regulations. Equity and access. Equitable access ensures that AI-driven interventions and healthcare services are accessible to all individuals, regardless of socioeconomic status or geographic location. Avoid reinforcing disparities. Avoid exacerbating existing disparities in healthcare access or outcomes through AI-driven intervention. Informed decision-making. Patient autonomy. Respect patient autonomy by involving them in decision-making processes related to their healthcare and AI-driven intervention. Informed consent provide clear and understandable information about the risk and the benefit and the implication of AI-driven intervention to patients. Continuous monitoring and evaluation. Ethical review. Conduct regular ethical review of AI application in healthcare to assess their impact on patient rights privacy, and fairness. Feedback mechanism. Establish a mechanism for patients and healthcare providers to provide feedback on AI-driven intervention, ensuring continuous improvement and responsiveness to ethical concerns. يبقى احنا اتكلمنا عن الداتا collection and integration, feature selection and engineering, model development, risk stratification, intervention design and optimization, evaluation والvalidation, implementation and deployment, ethical consideration. هنتكلم عن continuous improvement. من AI application of continuous improvement في risk stratification and intervention design in population health. أول حاجة data quality and integration. data refinement. Continuously assess and improve the quality of data used for risk stratification and intervention design, ensuring completeness, accuracy, and relevance. data integration. Incorporate new data sources زي updated electronic records, electronic health records, patient generated data from wearables to enhance the comprehensiveness and timeliness of insights. Model refinement and optimization. Algorithm update. Regularly update AI algorithm based on new research, advancement in machine learning techniques, and feedback from clinical use. Feature engineering. Refine feature selection and engineering processes to capture evolving health dynamics and improve model predictive performance. Performance monitoring and evaluation. Real-time monitoring. Implement systems for real-time monitoring of AI model performance, including metrics such as accuracy, sensitivity, specificity, calibration. Feedback loops. Establish a feedback mechanism from healthcare providers and patients to identify areas for improvement and address issues promptly. Ethical considerations زي bias detection and mitigation. Continuously assess AI models for bias and fairness issues, adjusting algorithms to ensure equitable treatment across diverse patient populations. With transparency and interpretability, enhance transparency in AI-driven prediction and recommendation, providing clear explanations for healthcare providers and patients. في stakeholder engagement, healthcare provider training. Provide ongoing training and education for healthcare providers on AI applications, ensuring they understand how to interpret and use AI-generated insights effectively. كمان في patient engagement, involve patients in the design and evaluation of AI-driven intervention, respecting their preferences and ensuring their active participation in decision-making. For regulatory, compliance and governance. Compliance reviews. Conduct regular reviews to ensure an AI application comply with regulation requirements and ethical guidelines for data use and patient privacy. With governance framework. Establish governance frameworks and oversight mechanisms to monitor the ethical use of AI in healthcare and address ethical concerns proactively. في collaboration and knowledge sharing, collaborative networks. Engage in collaboration with research institutions, healthcare organizations, and AI developers to share insight, best practices, and lessons learned in AI application for population health. ومن الكيس studies and benchmarking, analyze the case studies and benchmark performance against industry standards and peer-reviewed literatures to derive continuously improvement. من ال benefit of continuous improvement enhanced predictive accuracy, regular updates, and refinement improves the accuracy and reliability of AI models in predicting health risk and outcomes. Optimized interventions, iterative adjustment to intervention strategies based on real-world feedback lead to more effective and personalized healthcare intervention. كمان في ال ethical assurance زي ال continuous monitoring and refinement help address ethical consideration and ensure ال AI application uphold the patient rights and fairness principles. يبقى احنا كده اتكلمنا عن ال AI الريسك stratification والintervention design steps وازاي ال AI بيدخل بنستخدمه في كل الستبس بتاعة الريسك stratification والintervention design for population health. اتكلمنا عن الداتا collection and integration, feature selection and engineering, model development, risk stratification, intervention design and optimization, evaluation and validation, implementation and deployment في ethical consideration continuous improvement. By following these steps, healthcare systems can harness the power of AI to improve population health through targeted risk stratification and personalized interventions, ultimately leading to better health outcomes and reduced healthcare costs. لو في أي حاجة مش واضحة أستأذن حضراتكم ابعتولي على الشات. شكرا جدا لحضراتكم. دقيقة ونبتدي إن شاء الله السيشن اللي بعديها. شكرا جدا. مساء الخير. نكمل مع حضراتكم البروجرام بتاع النهاردة اللي بيتكلم عن ال AI Powered Population Health. مع حضراتكم دكتورة ماري حبيب Master in Healthcare Quality Management from High Institute of Public Health Alexandria University. اتكلمنا في السيشن الأولى عن ال Role of AI in Population Health.
السيشن الثانية عن البيج داتا and its role in population health. السيشن الثالثة عن الماشين ليرنينج fundamentals for population health professionals. السيشن الرابعة اتكلمنا عن ال AI powered risk stratification and intervention design. هنتكلم في السيشن دي عن ال AI for health emergency preparedness and response. ال health emergency preparedness and response. ايه هي يعني ايه الديفينيشن بتاع الهيلث emergency؟ الهيلث emergency preparedness and response involves the process and activities undertaken to prepare for, respond to, and recover from health-related emergencies or disasters. This can include natural disasters, such as hurricanes, earthquakes, pandemics, as well as public health emergencies like disease outbreaks or bioterrorism incidents. Health emergency preparedness involves the systematic planning, coordination, and implementation of measures to anticipate, respond to, and recover from health emergencies or disasters. هنتكلم عن ال key components and principles of health emergency preparedness. أول حاجة الريسك assessment. Risk assessment and planning are fundamental components of health emergency preparedness aimed at identifying potential hazards, evaluating vulnerability, developing strategies to mitigate risk and manage emergencies effectively. Identifying hazards في risk assessment and planning في health emergency preparedness من examples of hazards عندنا natural hazards زي geological hazards زي earthquake التسونامي meteorological hazards زي hurricanes السايكلونز التورنيدوز في hydrological hazards زي floods في biological hazards زي disease outbreaks pandemic epidemics vector borne diseases زي الملاريا الدنج فيفر اللايم disease food borne and water borne diseases زي contamination outbreak of illnesses caused by consuming contaminated foods or water sources leading to gastrointestinal problems and potential outbreaks. كمان عندنا technological and human-made hazards زي chemical hazards, industrial accident, release of toxic substance due to chemical spills or explosions. طبعا ده هيعمل respiratory problems, burns, long-term environmental contamination. في كمان radiological hazards زي nuclear accidents, release of radioactive materials due to accidents that can cause radiation exposure and long-term health effects. Transportation accidents زي mass casualty incidents زي plane crash, vehicle accidents resulting in multiple injuries or fatalities requiring rapid medical response and coordination. Identifying these hazards involve comprehensive risk assessment methodology that considers the likelihood of occurrence, potential sequence, and vulnerability of the population and infrastructure. By understanding and prioritizing these hazards, health emergency preparedness planners
can develop targeted strategies and response plans to mitigate risks, protect public health, and enhance community resilience during emergencies. احنا اتكلمنا عن الهيلث ريسك اسسمنت اند بلاننج، هنتكلم عن الريسورس مانجمنت. الريسورس مانجمنت سواء الريسورس identification and inventory زي الميديكال supplies, identifying and maintain an inventory of essential medical supplies including the pharmaceuticals, the vaccines, the medical equipment زي الفنتيليتر، الديفيبريليتر، personal protective equipment. كمان human resources, assess and plan for healthcare personnel needs including doctors, nurses, paramedic, pharmacists, laboratory technician, support staff. كمان infrastructure, inventory healthcare facilities including hospital, clinics, and temporary treatment centers, and assess their capacity to handle patient surge and operational needs during emergencies. Resource procurement and stockpiling. البروكروتمنت and planning في الريسورس procurement and stockpiling develop procurement plans to acquire necessary resources based on risk assessment with response plans and anticipated need during different types of emergencies. Maintain adequate stock of medical supplies and equipment in secure accessible location to ensure rapid deployment during emergencies. Logistics and distributions, distribution planning, سواء logistics والdistribution. Establish logistics plans for the timely distribution of resources to healthcare facilities and response location based on geographic consideration and incident severity. كمان arrange transportation options للميديكال supplies والpersonnel including the coordination with local transportation authorities and emergency services for efficient deployment. كمان allocation and utilization للresources. Prioritize and allocate resources based on the severity of emergency, the patient needs, and operational demands of healthcare facilities. Surge capacity planning, hospital surge capacity إن أنا أعمل development plan to expand the hospital capacity including adding temporary beds, establishing triage areas, and adapting spaces for patient care during surge in patient volume. Resource tracking and management system, inventory system. Implement systems to track and manage inventory levels, expiration dates, and usage of medical supplies and equipment. Effective resource management in healthcare emergency preparedness require proactive planning, collaboration across sectors, robust logistic capabilities, and continuously evaluation and improvement. By prioritizing resource management, healthcare system can enhance their ability to respond and effectively to emergency, safeguarding public health and minimizing the impact of disasters. اتكلمنا عن الريسك اسسمنت اند بلاننج، عن الريسورس مانجمنت في الهيلث ايمرجنسي بريبيرنس، هنتكلم عن الكوردينيشن اند كوميونيكيشن. الكوردينيشن عندنا الانترا ايجنسي كولابوريشن. في الانترا ايجنسي كولابوريشن سواء المالتي سيكتورال ابروتش engage with diverse stakeholders including public health agency, emergency management authority, healthcare providers, law enforcement, and community organization. الروles and responsibility لازم يبقى عندي clear assignment define الروles and responsibility for each agency and organization involved in the response, ensuring clarity of duty and accountability. Joint planning and training لازم يبقى فيه integrated planning, collaborate on the development of emergency response plans, protocols and standards, operating procedures that align with the roles and capabilities of each stakeholders. لازم يكون عندي exercises and drills. أكون عملت قبل كده conducted joint exercises and drill to practice coordination mechanism, test interoperability, and identify areas for improvement in communication and response coordination. Information sharing, real-time information, establish protocol and systems for real-time sharing of situational awareness, incident update, and critical information among response partners. كمان maintain a shared common operating pictures that integrate data from multiple sources to support decision-making and coordination efforts. في الcommunication, internal communication with organization, ensure clear communication channels with each organization and agency involved in the response, including hierarchy, reporting, procedures, and dissemination of directive. لازم chain of command تبقى واضحة, clear chain of command to facilitate efficient decision making and escalating of issues as needed. Public communication, timely and accurate information must be developed through strategies and protocol for disseminating timely and accurate information to the public media and stakeholders during emergency. Provide clear guidance on protective actions, evacuation procedures, healthcare resources available, and update on the evolving situation to mitigate misinformation and panic. Community engagement, involving stakeholders and engage them with community leaders, organization, and the public to raise awareness about emergency preparedness, educate on response protocols, and gather feedback on community needs and concerns. Cultural and linguistic consideration, tailor communication strategies to address cultural diversity and language preferences within the community, ensuring inclusivity and accessibility of information. Media relations, designate spokespersons and establish protocols for interacting with the media to provide accurate information, manage public expectations and address inquiries promptly, coordinate joint press conferences with key stakeholders to convey unified message and update on the emergency response efforts. Technology and tools, utilize robust communication technologies, including emergency alert system, social media platforms, and mobile applications to reach diverse audience and disseminate critical information efficiently. Evaluation and continuous improvement. After action reviews, conduct after action reviews following emergencies to evaluate communication effectiveness, coordination challenges, and overall response performance. Lesson learned, identify lessons learned and best practices from each emergency response to inform revisions of communication strategies, coordination protocols, and preparedness plan. Training and capacity buildings incorporate findings from after action reviews into training programs and capacity building initiatives to enhance coordination skills, improve communication practices, and strengthen resilience for future emergencies. Effective coordination and communication in health emergency preparedness require proactive planning, stakeholder engagement, and the integration of technology to ensure a unified response that protects public health and saves lives during crisis. اتكلمنا عن الريسك assessment and planning، الريسورس مانجمنت، الكوردينيشن and communication. هنتكلم عن التريننج and exercises. التريننج، الobjective of training programs، يا إما هيكون عندي skill development أو knowledge enhancement، أو بنعمل clarify للرول command والsafety protocol، أو specialized training، targeted programs for specific roles or disciplines زي medical personnel training in mass casualty management، زي public health officials training في epidemiological surveillance، زي logics staff training في resource management. interactive sessions that stimulate أو simulate emergency scenarios and allow participants to discuss response strategies with decision-making processes and coordination challenges in a controlled environment. Training methods زي classroom instruction، formal lectures، workshops، seminars، hand-on training، practical exercises and simulation زي online learning، e-learning modules، webinars. evaluation and certification زي assessment، evaluate the participant comprehension and proficiency through assessment, quizzes, practical evaluation. Issue certificates or credential upon successful completion of training programs to validate the competences and ensure compliance with training requirements. exercise، purpose of exercise سواء يكون السيناريو testing، stimulate أو simulate realistic emergency scenario to assess the effectiveness of response plans. skills application provide opportunities for participants to practice decision-making, teamwork, and communication skills. identifying gaps، identify strengths والweaknesses والarea for improvement في preparedness والresponse procedures resource management. types of exercise زي interactive discussions، زي functional exercises stimulate optional response activities in a controlled environment، زي full scale exercise اللي هي large scale simulations that replicate actual emergency conditions as closely as possible. exercise planning and execution، scenario development، design scenario based on identified risk، historical incident, and potential threats to test specific aspects of emergency response plans. We arrange logistics, equipment, facilities required for conducting exercises, ensuring safety and adherence to regulatory requirements. Provide participants with pre-exercise briefing, including scenario details, objectives, roles, expectations for active engagements. evaluation and after action review، بنعمل evaluate exercise performance through observation, participant feedback, and performance metrics related to response time, resource utilization, communication effectiveness. وبنعمل الاكشن بلان ديفلوبمنت develop the corrective actions and improvement basis on after action review findings to update response plans, revise the protocols, and enhance the training programs. Training and exercise are essential component of continuous improvement in health emergency preparedness, enabling stakeholders to build capacity, enhance coordination, and maintain readiness to respond effectively to diverse emergency scenarios and public health threats. احنا اتكلمنا عن الريسك اسسمنت وبلاننج، الريسورس مانجمنت، الكوردينيشن والكوميونيكيشن، التريننج اند اكسرسايز، الايفالويشن اند continuous improvement. الايفالويشن البيربز بتاع الايفالويشن assess الeffectiveness evaluate الeffectiveness of preparedness plans, response to action, and coordination efforts during exercise drills and actual emergency. برضو من ال purpose of evaluation identify the gaps, the strengths, the weakness, the area for improvement in response capabilities, the resource management, the communication. كمان quantify the performance metrics زي ال response times, the patient outcomes, the resource utilization, the compliance with protocols to benchmark progress and achievements. The methods of evaluation زي conduct structured debriefing and discussion immediately following exercise اللي هي after action reviews. كمان utilize predefined indicators and metrics to measure the key aspect of emergency response اللي هي performance metrics زي effectiveness of communication system زي adequacy of resource allocation, adherence للclinical protocols. كمان inputs from participants, stakeholders, community members through surveys, interviews, focus group to capture diverse perspective and insight on the response efforts. Area of evaluation زي evaluate comprehensive clarity and application of emergency response plans in addressing identified hazards and scenarios, assess the effectiveness of interagency coordination, communication protocols, information sharing practices during emergency, review adequacy and utilization of medical supplies, equipment, personnel, evaluate the strategies for public education, risk communication, engagement with diverse population to promote awareness and preparedness. Continuous improvement. Action plan development. Develop action plans and improvement initiatives based على review findings, performance evaluation and lesson learned from experience and real incidents. Prioritize the action to address identified gaps and vulnerability, focusing on areas with the greatest potential impact on response effectiveness and public health outcomes. Implementation of improvements. Update the emergency response plans with protocols with standard operating procedures to incorporate the lesson learned with best practice and updated guidance from regulatory authority. Monitoring and feedback. لازم يبقى عندي continuously monitoring للimplementation of improvement initiatives and their impact on response capabilities through periodic evaluation and performance review. Establish mechanism for ongoing feedback from stakeholders, including frontline responders, healthcare providers, public health officials, and community partners to assess the effectiveness of improvement and identify further area for refinement. Integration with organizational culture. Foster a culture with organization and across stakeholders groups that value preparedness, continuous learning, and proactive adaptation to evolving threats. يبقى احنا كده اتكلمنا عن الريسك اسسمنت، عن الريسورس مانجمنت، عن الكوردينيشن والكوميونيكيشن، التريننج اكسرسايز، الايفالويشن اند كونتينيوس امبروفمنت، نتكلم عن الريسبونس. اول حاجه الاكتيفيشن اند موبيلايزيشن. activate the emergency response plans and protocols based on predefined triggers or assessment of the severity and scope of the emergency. Implement an incident command system to establish a clear chain of command roles and responsibilities among responding agencies and stakeholders. Quickly mobilize personnel, equipment, medical supplies, resources needed to support the response efforts. Initial assessment and situational awareness. Deploy assessment teams to gather real-time data on the natural and extent of the emergency, including casualty, infrastructure damage, and community needs. Medical care and treatment. سواء prioritize و categorize the patient based on the severity of injuries or illness to allocate the medical resources effectively to provide immediate medical care, including the first aid, life-saving intervention with stabilization of critically injured or ill patients, establish temporary medical facilities or expand existing healthcare facilities to accommodate patient surge and provide continuity of care. في البابليك health intervention سواء عن طريق disease surveillance، عن طريق infection control، عن طريق vaccination والprophylaxis. في disease surveillance implement surveillance systems to monitor and track disease outbreaks, infectious pathogen, public health threats. في infection control implement measures to prevent the spread of diseases within healthcare setting and among the population, including isolation, quarantine, and hygiene protocols. Vaccination and prophylaxis, administer vaccines, prophylactic treatments, or preventive measures as necessary to protect vulnerable population from communicable diseases. Weak communication and public information, risk communication, provide clear and timely communication to the public, healthcare providers, and stakeholders regarding the nature of the emergency protective action and available resources. Coordination and logistics, coordinate the allocation and distribution of resources, including the medical supplies with personnel with equipment to meet the operational needs and support the frontline responder. Psychological and social support, provide a psychological first aid, counseling, support services to individuals and communities affected by the emergency, addressing emotional trauma and mental health needs. Continuity of operations, ensure the continuity of essential services such as healthcare facilities, emergency response operations, utilities, and communication systems to support the ongoing response and recovery efforts. Documentation and reporting, document response activities, incidents, patient outcomes, resource utilization, lesson learned for evaluation, analysis, and future planning. Evaluation and lesson learned, conduct after action review sessions to assess the effectiveness of response efforts, identify successes, challenges, and areas for improvement based on feedback from stakeholders and participants.
اتكلمنا الستبس بتاعتنا عن الريسك assessment and planning, resource management, coordination and communication, training and exercise, evaluation and continuous improvement, response، وهنتكلم عن recovery. phases of recovery عندنا immediate recovery assessment, conduct initial assessment to evaluate the extent of damage to healthcare facilities, infrastructure, community resources. عندنا intermediate recovery begin rebuilding damage healthcare facilities and infrastructure to restore functionality والcapacity. في long term recovery enhance healthcare delivery system to improve healthcare access and invest in healthcare infrastructure to build resilience against future emergencies. من key components of recovery في health emergency preparedness healthcare infrastructure rebuilding, repair or rebuild healthcare facilities including hospitals, clinics, temporary treatment centers to ensure continuity of medical service. Psychological and social support provide ongoing counseling, psychological support and mental health interventions to address trauma, grief, emotional distress among affected individuals and community. Environmental health and safety, conduct environmental assessment and remediation to address hazardous material, pollution, sanitation issues that may impact the public health. Economic and social recovery provide assistance and resources to restore a livelihood, businesses, economic activities disrupted by the emergency, we ensure access to social services including housing assistance, food security programs, educational support to promote stability and recovery in affected community. Learning and adaptation conduct a comprehensive after-action review to evaluate the response, efforts, identify strengths and weaknesses, and capture lessons learned for future preparedness and response learning. Long-term resilience building, implement measures to reduce future disaster risk, including infrastructure improvement, land use planning, and early warning system. Stakeholder collaboration عن طريق multi-sectoral approach foster collaboration among government agency, healthcare providers, non-governmental organization, private sector partners, community organization to coordinate recovery efforts and maximize the resources. Community participation engage affected communities in recovery planning and decision-making processes to ensure that recovery efforts address local needs and priorities. Recovery in healthcare emergency preparedness is a complex and dynamic process that requires comprehensive planning, coordination, collaboration across sectors to facilitate a sustainable recovery, strengthen resilience, and improve health outcomes for communities affected by emergencies and disasters. يبقى ديت الستبس بتاعتنا. طيب ازاي effective health emergency preparedness and response require strong leadership clear communication coordinated effort among multiple agencies and organization and adequate resources. طيب عايزين نشوف مع بعض ازاي AI application ساعدت في emergency preparedness and response. فأول حاجة هنتكلم فيها في الريسك assessment
and planning. ايه هي ال AI application في الريسك assessment and planning في الامرجنسي، في الهيلث emergency preparedness. اول حاجه، اول application ال early detection and surveillance. ال AI algorithm can analyze vast amount of data from various sources زي social media, ال health records, ال environmental sensors to detect early warning signs of potential health emergencies such as disease outbreaks or environmental hazards. كمان ال AI can identify patterns and anomalies في ال disease transmissions, allowing for early detection and rapid responses to emerging threats. من ال applications كمان في ال risk assessment، ال AI application، ال risk assessment and scenario planning. ال AI system can integrate ال heterogeneous data sources زي ال demographic data, ال epidemiological data, ال climate data to assess a risk and vulnerability specific to different population and geographic region. كمان ال AI driven models can simulate different scenarios based on real-time data inputs, helping planners anticipate to the impact of various emergency scenarios and optimize the resource allocation. في ال decision support systems, AI-powered decision support system can provide real-time recommendations to healthcare providers and emergency responders regarding resource allocation, patient triage, and treatment protocols during health emergency. كمان ال AI can optimize logistics and supply chain management by predicting demand for medical supplies and personnel based on dynamic conditions and response priorities. كمان في ال epidemiological forecasting, ال AI algorithm can forecast the spread of infectious diseases by analyzing historical data, population movement, and environmental factors, informing public health interventions and containment strategies. كمان ال AI can accelerate the vaccine development processes by identifying the potential vaccine candidates, predicting the efficacy, and optimizing the clinical trial designs. The public health surveillance and monitoring. The AI can analyze the social media and news feeds to monitor the public sentiment and detect misinformation or public concern during the health emergency, enabling timely communication strategies. كمان ال AI enabled system can automate the collection, analysis, and reporting of health data, facilitating a rapid dissemination of critical information to stakeholders and decision makers. في response planning and resource management, ال AI algorithm can dynamically allocate resources زي الميديكال سبلايز، البيرسونال based on real-time demand forecast and situational awareness optimization response effort. كمان ال AI driven optimization models can streamline the logistics operations زي ال transportations of medical goods or the deployment of emergency response teams to ensure a timely and efficient delivery. In natural language processing for communication, AI-powered natural language processing tools can analyze and generate natural language responses to public inquiries, automate responses to common questions, and monitor public perception during health emergencies. يبقى احنا اتكلمنا عن الابليكيشن في الريسك اسسمنت اند بلاننج. عايزين نتكلم عن الابليكيشن، الاي اي ابليكيشن فور resource management في الهيلث كير preparedness. أول حاجة predictive resource demand forecasting. ال AI algorithm can analyze the historical data, the real-time inputs, the epidemiological trends to predict the demand for medical supplies, equipment, personnel during health emergencies. These forecasting capabilities helps healthcare organization and emergency responders anticipate needs and proactively deploy resources to areas most likely to be affected. كمان في ال dynamic resource allocation. ال AI driven decision support system can optimize the allocation of resources based on real-time demand and supply information. طبعا this include the supply chain optimization, the personnel deployment, the inventory management and optimization. The AI can enhance the inventory management by monitoring the stock levels, the expiration dates, the usage patterns of medical supplies. The predictive analytic can forecast replenishment needs and prevent the stock out or overstocking. The AI-powered system كمان can facilitate just-in-time delivery of medical supplies and equipment to healthcare facilities based on real-time demand forecast and usage patterns. كمان ال operational efficiency and resources utilization. ال AI can assist in developing contingency plans and operational strategies that optimize resource utilization and minimize waste during emergencies. ال AI enable tracking resources كمان can monitor the movement and utilization of resources in real time, providing visibility into resource availability and usage across different locations. كمان في decision support for resource prioritization. ال AI algorithm can support the clinical decision making by prioritizing patient triage based on severity of illness or injury, available resources, بناء كمان على treatment protocols. During the resource shortage, the AI can assist in ethical decision-making framework by considering factors like the patient prognosis, the likelihood of survival, the equitable distribution of resources. في ال communication وال coordination, ال AI-powered communication platforms can facilitate real-time collaboration and information sharing among healthcare providers, emergency responders, and public health agencies to coordinate resource allocation and response efforts. اتكلمنا عن الريسك اسسمنت، البلاننج، الريسورس مانجمنت. هنتكلم عن ال AI application for coordination and communication في ال health emergency preparedness. أول application في ال real time data integration and analysis. زي ما ال AI algorithm can integrate and analyze data from various sources, including the medical record, the public health databases, the social media, the environmental sensors, to provide real-time situational awareness during the emergencies. كمان ال AI can identify patterns and trends in data, such as disease spread dynamics, resource utilization, population movement, to inform decision makers and facilitate a coordinated response. تاني application ال intelligent communication platforms. ال AI powered natural language processing tools can analyze and interpret ال unstructured data زي ال text message, ال social media posts, ال news articles to extract relevant information and trends related to the emergency. كمان ال AI driven chatbot can provide automated responses to frequently asked questions, disseminate critical information, and triage inquiries from the public and healthcare personnel during emergencies. في ال predictive analytics for resource allocation. مثلا ال AI algorithm can predict the resource needs based on epidemiological models, based على ال population demographics, عن ال historical data, facilitating the proactive resource allocation and logistic planning. كمان ممكن ال AI optimize the deployment of medical personnel with equipment and supplies to areas with the highest demand or greatest needs, ensuring efficient use of resources. في decision support systems, ال AI powered decision support system can assess the risk, prioritize response actions, and recommend mitigation strategies based on real-time data input and scenario simulation. كمان ال AI assist in developing and updating emergency response plans, protocols, standard operating procedures by analyzing the lesson learned from past emergencies and incorporating the best practices. في ال coordination among stakeholders, ال AI can facilitate communication and coordination among multiple agencies, organizations, in emergency response, ensuring seamless information sharing and joint decision making. كمان ال AI driven platforms can manage the tasks والassignments والworkflows among response teams, monitoring progress and ensuring accountability in executing response activities. في ال public engagement and risk communication, ال AI tool can monitor the social media platforms to track the public sentiment, detecting misinformation, and identifying emerging concern during a health emergency. كده احنا اتكلمنا عن الريسك assessment and planning, الريسورس مانجمنت، الكوردينيشن and communication. هنتكلم عن التريننج والاكسرسايز. ال AI applications for training and exercises in health emergency preparedness. أول حاجة simulation and scenario based learning. ال AI powered virtual environments can simulate realistic emergency scenarios, allowing healthcare professionals and emergency responders to practice decision-making, triage procedures, patient management in a controlled setting. كمان ال AI can develop interactive training modules that adapt to the learner's pace and level of proficiency, offering personalized learning experiences tailored to specific roles and responsibilities. في ال predictive analytics for training needs, ال AI algorithm can assess the proficiency and competencies of healthcare personnel through simulation and real-time performance analysis, identifying the training gaps with personalized learning path. كمان في ال virtual reality and augmented reality, ال AI powered virtual reality and augmented reality simulations can provide immersive training experiences for healthcare providers, allowing them to practice complex procedures, teamwork, and communication skills in realistic emergency scenarios. virtual reality, VR and AR, augmented reality technologies can simulate equipment operation, patient interactions, and emergency protocols, enhancing practical skills and preparedness without real-world consequence. في intelligent tutoring system. ال AI driven tutoring system can provide real-time feedback, coaching, and adaptive learning recommendations based on learner performance, improving retention and competencies development. ال data-driven insight and performance evaluation. ال AI can analyze the training data, including the simulation, the assessment, the participant feedback, to evaluate the training effectiveness, identify the strengths and weaknesses, and refine the training programs. كمان في ال natural language processing for learning resources, ال AI-driven natural language processing tools can curate and recommend relevant learning resources, research articles, case studies, and best practices in health emergency preparedness, enhancing knowledge dissemination and self-directed learning. كمان ال AI-powered chatbot and virtual assistant can provide instant answers to learners' inquiries, clarify concepts, and support ongoing learning during the training exercise. احنا اتكلمنا كده عن في ال health emergency preparedness, risk assessment and planning, resource management, ال coordination and communication, ال training and exercise. هنتكلم عن ال evaluation and continuous improvement. ال application في ال evaluation and continuous improvement, ال real-time performance monitoring. ال AI algorithm can analyze the real-time data from emergency response activities, including resource utilization, patient outcomes, and operational efficiency metrics. كمان ال predictive analytics للresponse planning. ال AI can simulate various emergency scenarios based on historical data and predictive models, evaluating response strategies and recommending improvements. After action reviews and lesson learned. An AI-driven system can automate the process of conducting after action reviews by analyzing response data, identifying strengths, weaknesses, and area for improvement. Feedback analysis and public perception. AI tools can analyze social media and public sentiment during and after emergency to gauge community perceptions, concerns, and effectiveness of communication strategies. Continuous learning and adaptation, an AI-powered system can continuously analyze new data, research findings, and best practices in emergency preparedness to update response protocols and guidelines. The decision support system, AI-driven decision support system provide real-time risk assessment and scenario analysis to guide decision-making during a health emergency. كده احنا اتكلمنا عن الريسك assessment and planning, الريسورس مانجمنت, الكوردينيشن and communication, التريننج and exercise, الايفالويشن and continuous improvement. هنتكلم عن الابليكيشنز of AI applications for response in health emergency preparedness. أول application عن ال early detection and surveillance. زي ما ال AI algorithm can analyze the various data sources including the health records, the environmental data, the social media trends to detect the early signs of disease outbreaks or public health emergencies. The resource allocation and optimization. The AI can optimize the allocation of medical resource supplies, the personnel, the equipment based on real-time demand forecasts with epidemiological data with geographic hotspots. كمان في ال decision support system, ال AI algorithm can assist healthcare providers in diagnosing and treating patients by analyzing the medical data, recommending treatment protocols, and predicting the patient outcome. في ال situational awareness and visualization. ال AI powered dashboard provide real-time situational awareness by aggregating and visualizing the data on disease spread, the healthcare capacity, and response activities across different locations. في ال communication and coordination, ال AI enable communication platforms facilitate real-time collaboration among healthcare providers, emergency responders, government agencies, and international partners. كمان في ال natural language processing, ال AI powered natural language processing tools can process and translate the multilingual communication, streamlines information sharing, and enhance situational awareness across diverse stakeholders. وفي ال public awareness, ال AI can analyze the public behavior and sentiments through social media monitoring and surveys, informing targeted communication strategies and public health campaigns. كمان ال AI algorithm can optimize the vaccine distribution plans by identifying a priority population, forecasting demand, and recommending vaccination sites based on population demographics and epidemiological data. كده احنا اتكلمنا في ال emergency preparedness عن ال risk assessment and planning, resource management, coordination and communication, training and exercises, evaluation and continuous improvement, responses. فاضل نتكلم عن ال AI application for recovery in health emergency preparedness. أول حاجة ال data driven needs assessment. ال AI algorithm can analyze the data on health, infrastructure damage, economic impact, and population health indicator to assess the extent of damage and prioritize recovery efforts. Resource management and allocation. The AI can assist in optimizing the allocation of recovery resources, including medical supplies, infrastructure, repair materials, personnel, based on real-time need assessment and predictive analytics. في ال health service restoration, ال AI algorithm can optimize the healthcare service delivery by predicting the patient demand, scheduling the appointments, and managing the patient flow in post-emergency setting. في ال infrastructure rehabilitation, ال AI can monitor and optimize the repair and rehabilitation of healthcare facilities and critical infrastructure, ensuring efficient restoration of essential services. في ال socio-economic recovery and support, ال AI-powered analytics can analyze labor market data, ال job displacement trends, ال economic indicators to support the workforce recovery and economic resilience efforts. كمان ال AI can facilitate the coordination and integration of social services, including the housing assistance, the mental health support, the community outreach, the programs to address the social determinant of health post-emergency. وفي ال decision support system, ال AI-driven decision support system can analyze the recovery policies, simulate the policy outcomes, and recommend evidence-based strategies for rebuilding health systems and communities. وكمان ال AI algorithm can assess residual risks, will anticipate future challenges, and support adaptive measurement and management strategies to enhance resilience against future health emergencies. In conclusion, the AI offer valuable tools and capabilities to support the recovery efforts in healthcare emergency preparedness by using data-driven insight, optimizing resource management, and enhancing decision-making processes. احنا اتكلمنا عن ال Health Emergency Preparedness والapplications of AI في ال Health Emergency Preparedness Steps. في أي حاجة مش واضحة أستأذن حضراتكم ابعتوا لي على الشات. شكرا جدا لحضراتكم. دقيقة إن شاء الله ونبتدي السيشن اللي جاي. شكرا لحضراتكم. Thank you very much.